The emergency room had been quiet for exactly 4 seconds when nurse Avery Collins reached under the supply cart, pulled out the compact trauma kit she'd modified herself, and loaded a pneumatic pressure injector with the efficiency of someone who had done it in the dark, in the rain, with enemy fire overhead. The room didn't go quiet because of the injector. It went quiet because the two Special Forces operators who had spent the last 40 minutes mocking her, calling her sweetheart, asking if she needed help reading the chart, had finally stopped talking. One of them was staring at her hands. The other one had gone pale. They recognized the movement, the grip, the posture. You don't learn that in nursing school. If this story already has your attention, stay with me until the end. Like this video, drop a comment telling me what city or country you're watching from. I want to see how far this story travels. The morning Avery Collins reported for her shift at Redwood Valley Military Medical Center, the sky over Boise was doing that thing it does in October. Pale gray, heavy with clouds that couldn't decide whether to snow or just threaten it. She parked in the staff lot, grabbed her thermos, and walked through the side entrance the way she always did, badge already out before she reached the scanner. Redwood Valley wasn't a civilian hospital. It served active-duty military, veterans, and their families, and it operated under a hybrid command structure that meant civilian medical staff existed alongside military personnel in a way that never entirely stopped being awkward. Avery had been working the trauma unit for 14 months. She was good at her job. She was also, by most accounts from the command side of the building, invisible, which suited her fine. "You're late," said Marcus, the charge nurse, without looking up from the whiteboard. He was 42, built like a linebacker, and had a habit of saying things that weren't technically accurate. "I'm 3 minutes early," Avery said. "Command shift briefing started at 0600. Your unit was supposed to have a rep." "My unit is a nursing unit. We don't send reps to command briefings." "Tell that to Colonel Hargrove." Marcus finally looked at her. He had the expression of a man passing along a problem he didn't want. "Something's coming in. Big. Special Operations Unit, multiple casualties, classified origin. They're bringing them to us instead of the base hospital in Mountain Home because—" He stopped. "Because why?" "Because 2 of them are in bad enough shape that they won't make it to Mountain Home." Avery set her thermos down. "How many total?" 8. 3 critical, 2 serious, 3 walking wounded that probably shouldn't be walking. "What kind of injuries?" "Blast and penetrating trauma. 1 possible spinal. And Collins," he lowered his voice slightly, "command is going to be crawling all over this place. Voss is already here." She didn't react to the name. She'd gotten good at that. Commander Derek Voss was the kind of military officer who had reached a position of authority through a combination of genuine competence in his early career and a sustained talent for managing upward. He was 51, silver-haired, and possessed the specific confidence of a man who had spent 2 decades being told he was impressive. He ran the Operational Liaison Division at Redwood Valley, which meant he sat between the hospital's medical command and the combat units that rotated through, and he took that position seriously in ways that were sometimes useful and often not. He had made clear, in his first week of overlap with Avery, that he did not particularly value civilian nurses in a military medical environment. He had made this clear not with anything she could formally report, but with the 1,000 small adjustments powerful people make, talking over her in briefings, redirecting her questions to the physician on duty, once physically stepping between her and a patient she was mid-assessment on to ask the attending a question that could have waited. 14 months. She'd learned to work around him the way you work around structural damage in a building. You know where the weak spots are. You don't lean on them. The trauma bay was prepped and waiting when the first transport arrived at 0720. Avery had her team ready. 2 other nurses, a tech, and Dr. Sasha Rubin, the attending trauma physician who was one of the few people at Redwood Valley that Avery genuinely liked. Rubin was in her early 40s, precise, dry-humored, and had exactly 0 patience for institutional theater. "Incoming," Rubin said, not looking up from her gloves. The first gurney came through fast. The medic pushing it was young, desert dust still on his uniform, and he was giving report before the doors finished opening. 26-year-old male, blast injury, left leg amputation below the knee in the field, tourniquet applied at 0400, BP 80/50 on arrival. Avery was already moving. She caught the IV line that had kinked during transport, straightened it, checked the tourniquet placement in one smooth motion, and called out the fluid order before Reuben had finished her visual assessment. "Good catch," Reuben said quietly, moving to the head of the bed. The second gurney came in 30 seconds behind the first, then the third. The trauma bay became the particular kind of organized chaos that looks like disorder from the outside and is actually an intricate system from the inside, everyone knowing their lane, the noise and urgency pulling focus rather than breaking it. Avery worked. That was what she did. She had a talent for the specific kind of attention that trauma nursing required. The ability to hold multiple threads simultaneously, to notice the thing that didn't fit, to stay calm, not because she was detached, but because she'd learned a long time ago that calm was a tool. She was adjusting the pressure dressing on the second patient when she became aware of someone standing behind her in a way that was not part of the medical team. "Nurse!" The voice was clipped, male, carrying the particular register of someone accustomed to being listened to. "Step back." She didn't step back. She finished the pressure adjustment. 3 more seconds. Then she turned. There were 2 of them. Special operations, she could read it in the way they stood. The stillness, the specific kind of physical presence that came from years of tactical training. One was mid-30s, dark-haired, a rank insignia she clocked without staring. The other was older, broader, with a jaw like a piece of equipment and an expression that suggested he'd already made up his mind about her. "I need a status on Sergeant Hayward," the older one said. I was looking past her at the patient on the table. "Dr. Rubin is the attending. She'll brief the unit liaison when we have a stable picture." "I'm not the unit liaison, sweetheart. I'm his CO. Avery held his gaze for exactly 1 second. "Then I'd ask you to step out of the active treatment area until we have something to tell you." The jaw tightened. "You're a nurse." "I am, and this is my patient right now, which means this is my space right now. You can wait outside the bay, or I can have someone escort you." He looked at her the way people sometimes look at an automated checkout machine that isn't cooperating. Not quite angry, more baffled that the thing isn't doing what it's supposed to do. Then he stepped back. Not far, just enough. The younger one caught her eye as she turned back to the patient. Something in his expression was harder to read. Not the reflexive dismissal she'd gotten from his CO, more like recognition of something he couldn't quite place. She filed it away and kept working. By 0900, the 3 critical patients were stabilized and moving to surgery or ICU. The 2 serious cases were assessed and assigned rooms. The 3 walking wounded had been triaged, treated, and sent to the recovery ward, where they were probably arguing about who had done what wrong on whatever mission they weren't allowed to talk about. Avery was charting in the nursing station when Commander Voss arrived. She heard him before she saw him. The measured click of his shoes on the tile, the shift in ambient noise that happened when authority entered a room. She kept her eyes on her screen. "Collins." He didn't stop walking. "My office. 10 minutes. She glanced up. "I'm mid-chart. 10 minutes. He kept moving. "Doctor." Rubin appeared at Avery's elbow approximately 8 seconds later, coffee in hand, expression neutral in the specific way that meant she was paying close attention. "What did you do?" Rubin asked. "Told a special operations CO to wait outside the active treatment area." Rubin sipped her coffee. "Which one?" "The one with the jaw. That's Major Callum Breck. He did 2 tours in Kandahar and he has the interpersonal skills of a load-bearing wall." Another sip. "Voss is going to make this into something." "Voss makes everything into something." "True. But this particular something has stars behind it. The unit that came in, they're not just any special operations. They're Delta adjacent. Whatever went wrong on that mission is going to attract attention from people with enough rank to make Voss actually do things instead of just threaten to." Avery saved her chart, stood up. "Then I'll go hear what he has to say." Voss's office was at the end of the administrative corridor, past the conference room with the flags and the framed photos of dignitaries shaking hands. It had a view of the parking lot, which Avery had always found appropriate. He was standing when she entered, which meant he'd decided to make this a standing meeting, which meant he wasn't offering her a chair, which meant he wanted her to feel the physical disadvantage of the space. She'd sat through enough of these to know the choreography. "Close the door," he said. She did. "Major Breck filed an informal complaint 40 minutes ago." He picked up a single sheet of paper, glanced at it, set it back down. The gesture was practiced. Claims you interfered with his ability to access his personnel. I asked him to step outside the active treatment area during a critical intervention. He's a major. You're a nurse. And in the trauma bay during a critical intervention, the attending physician and the assigned nursing staff have care authority over access to the patient. That's not a civilian-military tension. That's basic protocol. Voss looked at her. He had the kind of blue eyes that photographed well and communicated very little. You know what your problem is, Collins? She waited. You don't understand the environment you're operating in. This isn't a civilian ER. The men who come through that bay, they're not ordinary patients, and the people responsible for them are not ordinary administrators. I understand the environment. Do you? He moved around the desk, not aggressively. Voss was too careful for anything that could be documented. Just repositioning. Because what I see is a civilian nurse with good technical skills and very poor situational awareness. You do excellent work when you stay in your lane. When you step outside it, you create problems. I kept 3 critical patients stable. You antagonized the commanding officer of a special operations unit that is currently under federal investigation for a mission failure that resulted in significant casualties and equipment loss. He paused. That investigation is going to come here. People are going to be very interested in what happened in that trauma bay today, and I need to know that the staff I'm vouching for can behave appropriately. The word landed the way he intended it to. I behaved appropriately, Avery said. That's one interpretation. He went back behind his desk. The meeting was ending. I'm recommending you be reassigned to the outpatient clinic pending a review of this morning's incident, effective tomorrow. Avery looked at him. You're removing me from trauma? I'm reassigning you, temporarily, based on an informal complaint from a major who was asked to follow standard protocol. Based on my assessment that your presence in the trauma unit during a sensitive federal matter creates unnecessary complication. He sat. He opened a folder on his desk that probably wasn't related to this at all. You're dismissed. She stood there for 3 seconds, not because she was deciding whether to argue. She already knew that line, knew exactly where it ran and what it cost to cross it. She stood there because sometimes you needed 3 seconds to put something away before you walked out of a room with your face steady. Then she walked out. The outpatient clinic was on the 2nd floor of the hospital's east wing, past the physical therapy department and a long hallway that smelled permanently of industrial cleaner. It handled routine follow-ups, medication management, minor injuries, the bureaucratic tail end of actual medical care. It was not where Avery Collins should have been working. Everyone on the trauma unit knew it. No one said it directly. Marcus caught her in the break room at noon. He brought her a cup of coffee she didn't ask for and sat down across from her without asking if she wanted company, which was his way of being decent. Clinic, he said. Clinic. He shook his head slowly. Breck filed that complaint? Or Voss used Breck's complaint? Does it matter? Matters for what you do next. She looked at the coffee. I'm going to the clinic. I'm going to do my job. I'm going to wait. Wait for what? She didn't answer that. She didn't have a clean answer. She had instead a feeling she'd learned to trust over the years. The specific sensation of a situation that hadn't finished developing, like a weather system that looked stationary from the ground but was organizing itself at altitude. She went to the clinic that afternoon and triaged a knee strain, a medication question, a follow-up on a hand fracture, and a veteran who was there for paperwork but actually wanted to talk. So she talked to him for 15 minutes about his granddaughter's soccer tournament and the particular way time works differently when you get older. She did her job. She went home. She was back at 0600. The second day in the clinic was quieter. The third was quieter still. She was starting to think she'd misread the situation, that maybe Voss's move was just administrative irritation, a temporary exile that would resolve itself. When Marcus appeared in the clinic doorway at 13:30 and said, with the careful expression of someone delivering news they don't want to be blamed for, they need you back in trauma. Voss approved. Voss isn't here. There's a situation. She was already moving. What kind of situation? The soldier from Monday, Sergeant Hayward. He was in the ICU recovering from his surgeries, stable, expected transfer, tomorrow. An hour ago, he coded. What triggered it? That's the thing. Marcus kept pace with her in the hallway. His voice dropped. Nobody knows. The ICU nurse said everything was normal. She stepped out for 6 minutes. She came back and he was in respiratory arrest. But the monitors, Collins, the monitors didn't alarm. She processed that as they moved. Monitor failure during a patient arrest was not impossible. It was also not common. And it was also the kind of thing that, in a facility with this much federal attention currently pointed at it, carried implications that went beyond equipment malfunction. Who's running the code? Reuben. She asked for you specifically. They moved faster. The ICU was 2 floors up and Avery took the stairs. She pushed through the door at a controlled run, read the room in the first 2 seconds. Reuben at the head of the bed, 2 ICU nurses, a respiratory therapist, the particular stillness of a resuscitation that had been going long enough that everyone was starting to manage their expectations. What do we have? She said, moving in. Respiratory arrest, unclear etiology, 14 minutes down, Roski twice, lost it both times. Reuben's voice was flat and focused. His chest x-ray from this morning was clean. Talk screen from admission was standard. I need you to look at the IV line. The IV line. Just look at it. Avery moved to the IV setup. She checked the bag first. Standard saline, properly labeled, proper tubing. Then she traced the line down to the port. Something caught her attention. A small discoloration at the injection port. Faint. The kind of thing you'd miss if you weren't looking. Someone accessed this port, she said. Reuben looked at her across the bed. That's what I thought. When was the last documented access? 8:52. It's 13:40 now. Avery looked at the port again. The discoloration was consistent with a chemical reaction to something introduced into the line, something that didn't belong. She didn't say that out loud. There were other people in the room, and she didn't know yet who should hear what. Keep working the code, she said. I'm going to get the line analyzed. Don't go through the pharmacy system, Reuben said, which was the most information she could convey without saying anything specific in a room full of people. Avery took a sample from the line. She knew where to take it. There was a lab technician in the main lab, second floor, who processed samples without asking questions if you presented them as routine urgent requests with the right form. She'd used that route once before, a year ago, for reasons she'd never fully explained to anyone. She was at the lab door when her badge wouldn't scan. She tried it again. Nothing. She pulled out her phone and called the lab directly. The tech answered on the second ring. Hey, I have an urgent sample. Collins? The tech's voice was careful. Your access was suspended about 20 minutes ago. She stood in the hallway outside the lab. Suspended. Yeah. Administrative order. I don't have more details than that. She ended the call. Stood very still for a moment, thinking. Her badge access had been suspended, not revoked. That would come with formal notification. Suspended. Quickly, quietly, in the middle of a situation that was already complicated. Someone was managing the situation. She went back upstairs, but she didn't go to the ICU. She went to the records room on the 3rd floor, which still accepted her badge. Either the suspension was partial or someone had moved faster than the system could track. She pulled Hayward's admission records, the nursing notes, the medication log. She stood at the terminal and read through everything from Monday. She found it on the 3rd page of the nursing notes, an entry that had been added retroactively. She could tell by the timestamp formatting a discrepancy that was small enough to miss but didn't match the surrounding entries. The added note documented a medication administration that hadn't appeared on the original chart. A sedative, higher dose than the orders indicated, attributed to a nurse whose initials were listed as TR. Avery didn't know anyone on the ICU staff with those initials. She photographed the screen with her phone. 3 images, different sections. She closed the file and walked out. She was in the stairwell, 3 steps down from the 3rd floor, when the door below her opened and Major Callum Breck walked through it. He stopped when he saw her. She stopped when she saw him. They were alone in the stairwell, which had the industrial hum of a space that exists only for utility. Collins, he said. Major. He studied her face with an attention that was different from before. Not the dismissal of Monday morning, not the irritation of a man who wanted access to his soldier. Something more careful. I've been looking for you. My badge access was suspended. Something moved through his expression. Not surprised, she noted. Not quite. When? 20 minutes ago. He looked at the floor for a moment, then back at her. I owe you an apology, he said, for Monday. She didn't respond to that. I filed that complaint because I was frustrated and I took it out on you. That was wrong. He said it like someone who had practiced the words but still meant them, which was better than most people managed. But I need to ask you something, and I need you to answer me honestly. Ask. The morning you worked on my team, on Hayward specifically. He paused. Where did you learn to handle a tourniquet application like that? The stairwell hummed. Somewhere above them, a door opened and closed. Nursing school, she said. He shook his head slowly. No, that's not where you learned that. His eyes were direct, precise. The eyes of someone who had spent years reading people in conditions where misreading them had consequences. I've seen that grip in one context, one specific context, and it's not a hospital. She looked at him steadily, said nothing. Hayward is conscious, Breck said. They brought him back. He's critical, but he's talking. A beat. He asked for you, not Dr. Rubin, not his unit surgeon. He asked for the nurse with the dark hair who fixed his line on Monday. Another pause, waited. He said, and I'm quoting him, she knows. The hum of the stairwell. The distance between what she'd carried for years and the moment that had apparently decided to start catching up. He knows me, she said carefully. He says he recognized you, from somewhere you'd both been before. Breck's voice was level, but there was something working underneath it. He says he owes you his life. Not from Monday, from somewhere else. She held his gaze. My access is suspended, she said. I can't get to the ICU. I can get you in. He said it without hesitation. But Collins, before we go up there, I need to know if you understand what's happening in this facility right now. Because I think you do. And I think whatever is happening to Hayward is connected to someone in this building who wants this investigation to go away before it gets to the part where they're implicated. She thought about the falsified nursing note, the suspended badge, the discolored injection port, the monitor that hadn't alarmed. Who has the authority to suspend badge access on short notice? She asked. Command level, 2 or 3 people. He watched her face. Voss is one of them. She thought about Voss's office, the practiced gesture with the paper, the way he'd said review like it was a reasonable word for what he was doing. Let's go see Hayward, she said. They took the stairwell to the 4th floor, and Breck used his own access to get them through the ICU doors. The unit was quieter than it had been an hour ago. The code team gone, the equipment repositioned, the particular aftermath of crisis being absorbed back into routine. Hayward was in the 3rd room. He looked like someone who had nearly died twice in 4 days, which he had, pale, IV lines running, a ventilator tube recently removed by the looks of the tape residue on his face, oxygen running through a cannula instead. But his eyes were open, alert in the specific way of someone who had decided that being awake mattered. He looked at her when she walked in, really looked at her, and something in his face shifted. Not relief exactly, more like confirmation. It's you, he said. His voice was rough, barely above a whisper. It's me, she said. I wasn't sure. In the bay. Everything was moving. A breath. But then I remembered the way you moved. Nobody moves like that who hasn't... He stopped, looked at Breck, back at her. He knows? She asked quietly. He's trying to figure it out, Hayward said. Same as me. A pause. Operation Sandstone. The name landed in the room like a stone into still water. She watched it ripple across Breck's face. His eyes widened slightly, the first real crack in his composure she'd seen. That's classified, Breck said. His voice had changed. Lower. Careful. I know it's classified. Hayward looked at Avery. Tell him. She stood at the foot of his bed. Outside, the ICU monitoring stations hummed. The afternoon light through the small window had gone the color of cold metal. I can't tell him anything about a classified operation, she said. You saved us, Hayward said. All 7 of us. 12 hours in that valley, holding a perimeter that wasn't supposed to hold. The medic they sent us with was down in the 1st hour. He stopped. You were there. You know why they pulled you out afterward. You know what they made you sign. Breck was very still. Avery looked at the man in the bed, looked at the IV line she'd need to check, the vitals that needed monitoring, The job that was still her job regardless of what else was happening in this room or this building. "Get some rest," she said to Hayward. "You nearly died this afternoon." "Someone in this hospital tried to make sure I did," he said, "so I couldn't talk." "I know. They're going to try again." "I know that too." She turned to Breck. His expression had settled into something new. Not the brisk authority of Monday, not even the careful apology of the stairwell. This was something quieter and more serious. The look of a man reassessing everything he'd thought he knew about the situation he was standing in. "I need to use your phone," she said. "Mine's likely compromised." He handed it over without asking why. She dialed a number from memory. It rang twice. "Collins," said the voice on the other end. Male, unhurried, the kind of unhurried that was itself a form of intensity. "I need you to run a name," she said. "Redwood Valley Military Medical Center, Boise. Commander Derek Voss, Operational Liaison." She paused. Cross-reference with the sandstone file. Silence on the other end. Then, "That file is sealed." "I know. Run it anyway." Another silence. Longer. Then, "When did you surface?" "About 40 minutes ago," she said. "Whether I wanted to or not." She handed the phone back to Breck. He held it like it had become a different object. "Who was that?" he asked. "Someone who's going to make some calls." She looked at Hayward, then at the door, then back at Breck. "In the next few hours, this facility is going to get a lot more complicated. Someone tried to kill your soldier to keep a classified mission buried. That someone has enough internal access to falsify medical records, suspend staff credentials, and disable monitoring equipment without triggering an audit." She said it evenly, the way you say things that need to be heard clearly the first time. "That's not a rogue nurse. That's command level." Breck stared at her. "How do you know about the monitoring equipment?" "Because the ICU nurse said the monitors didn't alarm during Hayward's arrest." "Equipment failure doesn't explain that. Deliberate disabling does. And disabling hospital monitoring equipment without anyone noticing requires either extraordinary access to the system or someone who knew which alerts to turn off in advance." She paused. "Voss's background before he took the liaison role. What was it?" Breck's jaw tightened. "He was in signals and communications intelligence." "Right," she said. The ICU room was quiet except for the soft beep of Hayward's monitors, the working ones, and the sound of the wind picking up outside, the October cold pressing against the window glass. Hayward was watching her. He looked like he wanted to say something else but was too tired to say it, and she appreciated that he understood what tired was and what it was for. "Try to sleep," she said again. "They're going to come after you next," he said. She picked up his chart, checked the vitals, made a note. "Let them try," she said. She said it quietly, not dramatically, the way you say something true that doesn't need volume to land. Then she walked to the door, opened it, and stepped back out into the corridor where Commander Voss was standing 10 feet away with 2 military police officers and an expression that had finally stopped pretending to be reasonable. Voss looked at her the way people look at something they've decided to treat as a problem instead of a person, and Avery looked back at him the way she'd learned to look at things that were dangerous without letting them know she'd assessed them as such. "Collins." His voice was even, controlled. The military police officers on either side of him were young, both of them, and neither one looked entirely comfortable. "You're in a restricted unit without active credentials." "Major Breck authorized my access," she said. Voss didn't look at Breck. "Major Breck doesn't have the authority to override a suspended credential in this facility." "Then take it up with Major Breck." She started walking. Not toward him, at an angle, toward the nurses' station, the way you move in a space when you know the space and the other person is counting on you not to. "I have a patient I need to check on." "You don't have patients anymore, Collins. You're on administrative suspension pending investigation." She stopped, turned. "Investigation into what?" "Unauthorized access to patient records. Possible tampering with medical documentation." He said it smoothly. The preparation was obvious. "This is a formal administrative hold. These officers are here to escort you out of the building." Breck stepped forward. "Commander?" "Major Breck." Voss's voice sharpened by a precise half-degree. "I understand your unit has a vested interest in the patients on this floor, and that interest is noted, But this is a facility matter, and it's being handled through facility channels. Breck was quiet for a moment. His jaw was doing the thing it did when he was managing what he wanted to say. Sergeant Hayward just survived a cardiac arrest, under circumstances that are not yet explained. I'd like that explanation before anyone leaves this floor. The medical team is looking into it. Which medical team? Because the nurse who identified an anomaly in his IV line is about to be escorted out of the building. The two MPs shifted slightly. They were picking up the current running underneath the conversation, and neither of them had signed up for whatever this was. Voss looked at Avery. Come quietly. This doesn't have to be complicated. It's already complicated, she said. It got complicated when someone accessed Sergeant Hayward's I-4 line between 0852 and 1340 and introduced something that wasn't on his medication order. She said it clearly, at a volume that the nurse's station could hear. I documented what I found. I photographed the records. And about 20 minutes ago, I made a phone call that I think you're already aware of, which is probably why my badge got suspended so quickly. The ICU was listening, not obviously. People were still doing their jobs, monitors were still beeping, but the particular quality of attention in the room had changed. Voss's expression didn't break, but something behind it did something small and involuntary. She caught it. Escort her out, he said to the MPs. Breck took another step. I want it on record that I am formally objecting to the removal of a witness from an active medical situation with possible criminal implications. Noted, Voss said. Record it with the JAG office. Avery looked at Breck. One beat. She needed him to understand something without her saying it, and she wasn't certain he'd been in enough situations where nonverbal communication was the only channel available to know how to read her. But he met her eyes, and something in his expression said, I see you. Keep going. She let the MPs walk her out. She didn't make it hard for them. In her experience, the times when you needed to conserve your decisions were exactly the times when people expected you to spend them on gestures. They took her badge, what was left of its functionality, and walked her to the main entrance and said she'd be contacted regarding the investigation timeline. She thanked them, which seemed to confuse the younger one, and walked to her car. She sat in the driver's seat for a moment. The parking lot was ordinary, a truck backing out of a spot, a couple walking toward the entrance. The October sky had gone dark gray, the kind of gray that had given up on threatening and was now just committed to being gray. She thought about Hayward's face when she'd walked out. She thought about the voice on the phone, the long pause before he'd said, "When did you surface?" The way he'd said it like it was a question about geography. She pulled out of the parking lot and drove 4 blocks to a gas station. She went inside, bought a bottle of water she didn't want, and used the payphone on the exterior wall to dial the same number she'd dialed on Breck's phone. It rang once. "They move faster than I expected," she said when the line picked up. "How fast?" "Badge suspended, same afternoon. I'm out of the building. They're calling it a records tampering investigation." "Evidence?" "Photographed the falsified nursing entry, documented the IV line anomaly. Breck was present for both." She paused. Hayward said the name. Silence on the other end that was different from the earlier silence. Heavier. "To who?" "Breck. And me." Breck didn't know what it meant, but he knows it means something now. "That's going to create a cascade." "I know. How long do I have before it gets loud?" "If I move the sandstone file through the right channels, 12 hours maybe. Depends on who Voss has insulated himself with." A pause. "Collins, what you found in that IV line, if it's what I think it is, this isn't just Voss protecting a bad mission debrief. This is active suppression of a federal witness. Hayward. And potentially you. You're in those records." She hadn't said that to herself yet in those terms. She processed it the way she processed things in the field, not by not feeling it, but by putting it in the right compartment. "What do you need from me?" "Stay available. Don't go home tonight. Do you have somewhere else?" "Yes." "Don't tell me where. And Collins, if someone approaches you in the next 12 hours claiming to be federal coordination, I'll ask for the sandstone verification code." "Good." The line was quiet for a moment. "You didn't want to surface." "No." "I'm sorry." "Don't be." She looked at the parking lot through the gas station window. "Hayward nearly died. Someone in that building did that on purpose. That's not something I can drive away from." She hung up. drank some of the water, got back in her car. She drove to a motel on the west side of the city, the kind of place that had been average in the 1990s and had reached a stable equilibrium of functional adequacy since then. She paid cash. The woman at the desk didn't look at her twice. The room smelled like air freshener covering something older. The TV was bolted to the dresser. She sat on the edge of the bed and thought about what she knew and what she could prove and what the distance was between those two things. She'd been careful for 4 years. Not paranoid, just careful. Civilian nursing career, steady employment, a life that was genuinely her own, even if it was layered over something she wasn't supposed to talk about. She'd been good at it. She'd been good at the work itself, which helped, because it gave her a reason to be in these places that wasn't a cover. It was real. The trauma unit was real. The patients were real. Hayward was real, and someone had nearly killed him. She opened the notepad on the desk and wrote down everything she remembered from the falsified nursing entry, the timestamp discrepancy, the medication listed, the initials TR. She wrote it in a shorthand that would be meaningless to anyone who hadn't been in the particular operational context she'd come from, which was itself a form of encryption. Then she lay back on the bed with her shoes still on and closed her eyes, not to sleep, but to think. At 0300, her phone buzzed. The number was one she didn't recognize, and under normal circumstances she wouldn't have answered it. But the area code was one that had meaning in the specific geography of her history, so she picked up. "It's Breck," said the voice. She sat up. "How did you get this number?" "Your emergency contact is on file at the hospital. Marcus Teller. I called him." A pause. "He said you'd be annoyed, but you'd pick up." Marcus. She made a note to say something to him about that, and also to thank him. "What's happened?" she said. "Something happened at the facility about an hour ago. A security breach. Someone cut the exterior camera feeds on the east wing and accessed the pharmacy storage on the second floor." His voice was controlled, but the edges of it were sharp. "They took a specific compound, not in large quantities, not the obvious things. A paralytic agent. Hospital grade." She was quiet. "Hayward's room has been moved," Breck said. "I did it myself about an hour before the breach. New room isn't in the system yet. I had a feeling." He stopped. "I don't usually operate on feelings." "What made you?" "Something you said. About the monitor disable. About what it takes to do that without triggering an audit." Another pause. "I looked up Voss's background file after you left. His signals and communications work. The specific installations he consulted on." The line was quiet for a moment. "3 of them are hospital systems, including this one. He did a security infrastructure assessment 18 months ago before he took the liaison role. He knows the system from the inside. He knows exactly which fail-safes to bypass and which ones are noise." Breck's voice had gone somewhere flat and certain. "This isn't a commander covering a bad mission. This is something else." "What's the investigation finding?" she asked. "On the mission Hayward's unit was on. I don't have full access, but what I've been told, informally, is that the mission failure involved equipment that shouldn't have been there. Weapons components, routed through a procurement channel that doesn't track back to standard military supply." She let that settle. "Off-book supply chain. With someone at the logistics end who knew how to paper it. JAG is looking at 3 people. Voss is on the peripheral list, not the primary focus. Yet. He knows he's on the list," she said. "Has to. And Hayward's unit, they saw something, on the mission, something that connects to the supply chain." "That would be my read," Breck said, "which is why someone needed Hayward not to give a debrief." She stood up, moved to the window, looked out at the parking lot. A semi was pulling in, headlights sweeping the dark. "Breck, the breach tonight. Was it contained?" "As far as we know, but Collins..." He stopped. "There's something else. After the breach, one of the MPs who escorted you out, the younger one, he came to me. Said he'd overheard Voss on a phone call earlier this evening. He didn't get all of it, but he got enough to think someone is being brought in, from outside the facility." "Brought in to do what?" "He didn't know. But the phrase he heard was, 'finish the problem.'" Breck's voice was careful now, very careful. "I don't think they're just trying to suppress Hayward's testimony anymore. I think they're cleaning up, and you were in that room when Hayward said the name, which makes you part of the problem," she finished. I'm moving Hayward again tomorrow. I have 2 men I trust on guard. But Collins, you need to come back in. I was formally removed from the facility. Voss removed you, but Voss doesn't have unilateral authority to bar a federally contracted medical employee from a federal medical facility during an active patient safety investigation. I've already filed the paperwork to have your removal reviewed. It'll hold for about 12 hours before someone above Voss decides whether to affirm it or overrule it. 12 hours. If you come in through the maintenance entrance on the north side at 0600, I can get you to Hayward before any of the administrative layer is fully staffed. You can talk to him. Properly. Document everything he can tell us. By the time Voss knows you're there, we'll have a record that's too established to bury. She thought about this. It wasn't a clean plan. It had at least 4 points where it could go wrong depending on who else Voss had positioned in the facility. But clean plans were for situations where you had time and resources and a cooperative institutional environment, none of which applied here. I'll be there at 0545, she said. I'll have someone at the door. She ended the call and stood at the window until the semi finished its parking maneuver and everything went still again. Then she sat down and spent the next hour writing out everything she remembered about Hayward's case, the timeline, the physical evidence, the documentation discrepancies, in a format that would hold up to review. She photographed it with her phone and sent the images to an encrypted account she'd set up in what now felt like a different life. She slept for 2 hours, set an alarm for 4:30. When it went off, she was already half awake, the way she used to be on deployment when sleep was always provisional. The drive back to Redwood Valley in the pre-dawn dark was quiet. Boise's streets at 5 in the morning have a particular emptiness, not abandoned, just resting. She drove without the radio, thinking about Hayward, about what he could tell them if they could get him talking on record, about what Voss would do when he realized the timeline was closing. The maintenance entrance was on the north side, like Breck had said, accessible by a service road that ran behind the facility's utility infrastructure. She parked a block away and walked. A figure was waiting at the door. Not Breck, but someone she recognized from the ICU rotation, one of the nurses. A young man named Torres, who she'd worked alongside twice without learning much about him, except that he was methodical and didn't waste words. Collins, he said. Torres. He said to take you up the freight elevator. Hayward's on 6 now. He scanned his badge and held the door. Commander Voss doesn't come in until 0700 typically. You've got some time. Typically, she said. Yeah. He looked like he knew what that word carried. The freight elevator smelled like disinfectant and old rubber, and it moved with the patient lack of urgency of industrial machinery. She wrote it to 6, and Torres walked her down a service corridor to a room that wasn't on the main patient wing. It had the feel of a place that was being used off schedule, a recovery room repurposed, the monitoring equipment brought in separately. Breck was there. He looked like a man who hadn't slept, which he probably hadn't, and he'd traded his uniform for civilian clothes, which was either tactical or practical or both. He's awake, Breck said. He's been asking about you. She went in. Hayward looked worse than the day before, in the way that people sometimes look worse when the immediate crisis passes and the body finally admits how badly it's been used. His color was poor. His voice was still rough, but his eyes were the same, alert, decided. Sit down, she said. You don't need to perform. He almost smiled. Yes, ma'am. She pulled up the chair beside the bed. Breck stayed near the door far enough to give the room some air. Tell me about the mission, she said. What you can tell me. Hayward looked at the ceiling for a moment. We were doing a recovery op. Southeastern Territory, hostile controlled. The mission package said we were there for personnel, a captured intelligence asset, standard enough. We'd done similar 3 times before. He stopped to breathe. It cost him something. But the drop zone had equipment waiting, not ours, not the kind of equipment that shows up in official mission packages. Weapons components, she said. High-end, the kind that has export classifications, the kind you don't accidentally find in a hostile-controlled compound. His jaw tightened. 2 of my guys wanted to document it. We had a camera. We started photographing. A pause. That's when the compromised intelligence happened. Someone alerted the compound. We got hit 10 minutes after we started photographing. Who knew the full mission package? Ground level. Just us. But the logistics pipeline, where the drop zone coordinates came from, where the mission parameters originated. He stopped. That's command level, multiple points. But the specific channel that gave us the drop zone had a signature that JAG identified in about 40 minutes once they started looking. Voss, she said. Voss signed off on the logistics consultation that set up that channel 18 months ago. He looked at her. He's not the source. He's a node. But he's a node who knew we were coming back with photographs and a lot of inconvenient questions, and he had the access in this facility to make sure those questions didn't get asked. She sat with that for a moment. The room was very still. The photographs, she said. Do they still exist? Hayward's expression shifted into something careful. That's the thing. He glanced toward Breck, then back at her. Before we got extracted, before everything went wrong, Schatz, Castellano, my comms guy, he transmitted, partial. We didn't know if it went through. Transmitted to where? Backup channel, classified relay. He met her eyes. The same relay that was activated on Operation Sandstone. The same relay. The same operational network that she had been part of, briefly, 4 years ago, in a valley she was not supposed to remember being in. If that transmission went through, she said slowly, then somewhere there's a server with photographic documentation of what your unit found, and whoever is on the other end of that relay knows what you saw. And knows what Voss is connected to, he said. She thought about the voice on the phone, the Sandstone file, the long pause when she'd said cross-reference with Voss. How long has Voss known Hayward's unit had those photographs? Breck asked from the door. Since the debrief, or what was supposed to be the debrief. Hayward's expression went somewhere darker. We got pulled into separate rooms, standard practice, but the questions they asked, they weren't standard. They were trying to find out what we transmitted, what we had. He looked at the ceiling again. I didn't tell them about the relay. Neither did Castellano. We agreed before extraction that we'd hold that. Castellano, Avery said. Where is he now? The silence that followed was one of the worst kinds, the kind that answers the question before anyone speaks. I was transferred to a facility in Denver, Breck said. His voice was carefully flat. 4 days after the mission, reported complications from a wound injury. He died in transit. Avery looked at him. I didn't know about the relay, Breck said. I didn't know what Castellano and Hayward had transmitted. I only started connecting these events when Hayward ended up in your trauma bay and someone tried to kill him while he was in my care. His jaw moved. This is my unit. These are my people. And someone has been killing them quietly and calling it complications. The room was very still for a moment. Outside, the hospital was beginning its morning cycle. Shifts changing, the ambient sounds of an institution waking up. The relay, Avery said to Hayward. If I can access it, if I can pull what Castellano transmitted, it becomes federal evidence. Documented, time-stamped, unalterable. You have access to the relay? Breck asked her. She didn't answer that directly. What I have, she said carefully, is a contact who can initiate an access request through the proper channels. The kind of channels that don't get monitored by facility-level command. Breck looked at her for a long moment. She could see him reassessing again, adding this to the accumulating picture of who she was and what she'd been, recalculating. She was used to that. She had over time stopped minding it. It was the people who didn't reassemble their understanding when presented with new information that you had to watch out for. Do it, he said simply. She stood up, looked at Hayward. How are you actually feeling? Like someone tried to kill me twice. You'll be in worse shape before this is over. Can you handle documentation? Official statement? JAG level? I can handle it. Good. She moved to the door. Breck stepped aside. I'm going to need 30 minutes and a secure line. There's an office at the end of the corridor, Torres said from outside the door. She hadn't realized he was still there. No one uses it on early shift. Line's secure. It's the one they use for surgeon consults from home. She nodded. Went. The office was small, windowless, smelling of old coffee. She closed the door and sat at the desk and dialed the number again. It rang 4 times, which was different from before. You know what time it is, said the voice when it picked up. 4:57, she said. I need access to the Sandstone relay, partial transmission from approximately 72 hours after the mission went wrong. The sender is listed as Castellano. A long pause. Castellano is deceased. I know. Collins, what you're asking, I know what I'm asking. The transmission may contain photographic documentation of illegal weapons components routed through a fraudulent logistics channel tied to a currently active facility commander. Someone has already died. Someone else nearly died twice. If that evidence exists on the relay, it needs to come out before whoever is managing the cover-up gets another chance. She stopped. Someone is being brought in tonight to finish the problem. That's the phrase that was used. I don't know if the problem is Hayward or me, or both, but I know we're out of time. Another pause. Longer. I'll need 2 hours to initiate the request without leaving a flag in the wrong system. You have 90 minutes, she said. After that, the shift changes and Voss comes in and whatever window we have closes. Silence. Then, 90 minutes. Don't go back into that building until I call you. That's going to be complicated, she said. I'm already in it. She heard something that might have been a brief, unhappy exhale. Of course you are, he said, and ended the call. She sat in the small office in the quiet, thought about Castellano, who she'd never met, who had died in transit between one facility and another, which was such a quiet, manageable way to die that no one had looked too hard at it. Thought about Hayward in the room down the corridor, alive because Breck had moved him on a feeling he didn't usually operate on. Thought about Voss, coming in at 0700, walking through the main entrance with his silver hair and his practiced calm, not yet knowing how much had shifted in the night. At 0620, Torres knocked on the office door. She opened it. His face was the face of someone who needed to deliver bad news and was deciding how fast to do it. What? She said. Camera feeds, he said. The external ones that were cut during the breach last night. They just came back online. Maintenance said they didn't restore them. They came back on their own. He paused. Someone's in the system, active right now. She stood up. Which cameras? The freight elevator. He looked at her. The service corridor to the recovery ward, and the maintenance entrance on the north side. Every route they'd used to bring her in. She was already moving past him into the corridor, already mapping the distance to Hayward's room, already thinking about what you did when the situation closed faster than your plan anticipated, which was something she knew how to do, had always known how to do, even when she'd spent 4 years trying to be someone who didn't need to. She was 20 feet from Hayward's door when the lights in the corridor went out. Not all of them. The emergency lighting kicked in within 3 seconds. The low red glow of backup power, enough to see by if you knew how to use it, which Avery did. She'd worked enough night shifts to know exactly how that light fell, where the shadows pooled, which sections of corridor became effectively blind. She didn't run. Running created noise, and noise created information for whoever had accessed the camera system. She moved fast and low, the way you move when you're trying to be a smaller signal, and she was at Hayward's door in 8 seconds. Breck was already inside, standing, his hand on the wall switch that wouldn't work. One of his 2 guards, a solid-looking sergeant named Petrie, was at the window. The other, a younger specialist whose name she hadn't caught, was at the door to the ensuite bathroom, checking angles. Someone's in the system, she said, keeping her voice at the level of the room. Camera feeds came back online on the routes we used. Freight elevator, service corridor, the maintenance entrance. Which means they know you're here, Breck said. Which means they know where Hayward is. Hayward, in the bed, was watching all of this with the expression of a man who had been in enough bad situations to recognize one and had learned not to waste energy on panic. What do you need me to do? He said. Nothing yet. She looked at the door, then at the window. 6 floors up, no useful exit there. Then at Petrie. Does this wing have a stairwell at both ends? North end, Petrie said. South end has a locked maintenance hatch. Requires facility keycard. She looked at Breck. He had a facility keycard. She'd seen him use it at the ICU. His expression told her he'd already thought of this. South stairs, she said. If we move him now, before whoever's coming reaches this floor. He's not ambulatory, Breck said. The paralytic they took from the pharmacy. If that's what they planned to use, it means they wanted a quiet kill, which means they may not be equipped for a physical confrontation. Don't assume that. I'm not assuming it. I'm noting it as a variable. He looked at Hayward, making the calculation she was also making. How much movement a man with Hayward's injuries could tolerate. What the risk matrix looked like between moving him now versus staying and hoping the variables Breck had just laid out were accurate. I can move, Hayward said. I've moved worse. You have two surgical sites that are less than 72 hours old, she said. I'm aware. She made the decision. We move. Wheelchair if there is one, gurney if there isn't. Petrie on point, Breck rear. I'll manage the IV. She was already looking for the manual release on the bed rails. Torres, is he still in the corridor? Breck stepped to the door and looked out. He's here. Tell him to get the wheelchair from the supply room at the end of the hall. Now. While Torres moved, she disconnected the monitor leads, carefully, not because she was worried about alarms going off. The power was unreliable anyway, but because clean disconnection mattered for when he needed to be reconnected. She secured the IV lines to the portable stand, checked his BP manually, low but functional. His face was tight. On a scale of 1 to 10, she said quietly. 4, he said. She knew he was lying by about 3 points. She appreciated that he was trying to be easy. I'll get you something for the pain when we're somewhere stable. I've had worse. You keep saying that. Keeps being true. Torres came back with the wheelchair. Getting Hayward into it took 90 seconds and cost him more than he was showing, and she filed that debt away as something she'd need to address as soon as the immediate situation allowed. She had learned, over years of working with people who were trained to minimize their physical distress as a professional attribute, that you had to read the body instead of the report. His breathing was shallow and fast, which meant pain management was going to become a priority soon regardless of circumstances. They moved into the corridor. The red emergency lighting turned everything into a medical drama aesthetic that was deeply unwelcome given that they were actually in one. Petrie went first, moving with the cautious economy of someone who'd cleared corridors before. Torres pushed the wheelchair. Avery managed the IV stand, keeping it upright, keeping the lines from tangling. Breck was at the rear, and the young specialist, whose name she still didn't know, moved alongside the wheelchair on the left. The south stairwell was 40 feet away. They covered 35 of them before the stairwell door opened. The man who came through it was not in uniform. He was in maintenance coveralls, which was either a genuine maintenance worker or someone who had thought about this ahead of time. I was large, carrying a bag, and the half-second before he saw them was the same half-second Petrie needed. Petrie moved first, fast, controlled, the kind of physical intervention that ended things quickly and left no ambiguity. The man in the coveralls went down, and Petrie had the bag secured before anyone else in the hallway had fully processed what had happened. The specialist zip-tied the man's wrists with something from his vest pocket that suggested he'd anticipated needing it. Breck crouched, went through the bag fast, looked up at Avery. She already knew what was in it from his expression, but she looked anyway. A preloaded syringe. High-concentration paralytic. She could identify it by the vial in the side pocket. Enough to stop a man's respiratory system in about 4 minutes if administered correctly. There was also a secondary item she hadn't expected. A small device, roughly the size and shape of a portable radio, with an antenna and a single LED that was currently green. Signal jammer, Breck said. He wasn't alone, she said. They moved faster. The south stairwell was clear. They got Hayward through it and down 2 floors to the 4th level before she called a stop. He was managing, but his breathing was deteriorating towards something she needed to address. They put him in an empty room on the cardiology unit, which was the least obvious location she could think of, given that it had nothing to do with trauma, surgery, or intensive care. She had him reconnected to a portable monitor within 4 minutes. His oxygen saturation was lower than she wanted, 91%. She put him on supplemental oxygen and adjusted his positioning and watched the number climb to 94, which was acceptable. His BP was still low. Breck, she said. The man in the coveralls. He had a green LED, active. That means the jammer was running, which means any call we make from inside this building right now is probably going through a compromised channel. Breck was on his phone, looking at it with the expression of someone receiving exactly the information she'd just predicted. No signal. The jammer has a range. If Petrie and the specialist can move it physically out of range. On it, Petrie said, already moving, which left her, Breck, Torres, and Hayward in a cardiology room on the 4th floor, with a signal jammer operating somewhere in the building, at least one compromised operative detained in the stairwell, and no clear picture of whether there were more. Voss comes in at 0700, she said. It was currently 0641. When he realizes we moved Hayward and that his operative has been detained, he's going to move to Plan C, whatever that is. He could try to trigger a facility lockdown, Torres said. Frame it as a security event. Get some legitimate control of the building. He'd need a reason. Detain person in the stairwell, Torres said. If Voss gets to that before we do, he'll spin it however he wants. She thought about this. Can you get me to the administrative security office? Torres looked uncertain. My badge should work on that floor. Go. I need the facility security log for the last 6 hours. Raw data, not the summary report. Download it to a drive if you can. If someone has been running those cameras and accessing the system, there will be traces in the log even if they tried to clean it. She looked at him. Can you do that? I think so. Torres. She waited for him to look at her directly. I need to know you can do it or I need a different plan. He held her gaze. I can do it. He left. Breck stood in the center of the room with his arms crossed, the posture of a man who was used to being the person with the most information and currently was not. Talk to me, he said. What's your read? Voss didn't plan this alone. The man in the coveralls knew our route. That means someone in the chain of communication, somewhere between you, me, Torres, or this building's infrastructure, is feeding information. Torres? Possible, but low probability. If Torres was feeding information, we'd have been intercepted before we got Hayward to the recovery room last night. The specialist, Breck said. I brought him in from outside my regular rotation. She looked at him. He came highly recommended through a logistics liaison contact, Breck said. His voice had gone quieter. Controlled in the way that things get quiet when a person is managing something large. The same logistics channel that Jag is currently looking at. She let that land without comment. Breck was doing his own reckoning with it. She could see it in the way he stood, the particular stillness of someone holding something heavy. Where is he now? She said. With Petrie. Moving the jammer. She was already moving to the door. Get Petrie on a direct line. Not the facility channel. Personal cell. Tell him to secure the specialist. Breck moved. She heard him in the corridor, voice low and sharp, and she went back to Hayward. He was watching her. He'd heard enough. How bad is it? He said. We have a leak somewhere in the chain. Breck is handling it. She checked his oxygen saturation again. 94. Holding. How's the pain? Tell me what's happening with it. We're at about 45. He'll call when he has it. If the jammer comes back online, we'll deal with that. She adjusted his oxygen. Hayward, before all of this, why didn't your unit report what you found to your immediate chain when you found the weapons components? He was quiet for a moment. Breck wasn't on the mission package. The immediate chain above the insertion team was the logistics liaison, which was Voss's network. Reporting it through the official channel would have been reporting it directly to the person we were reporting about. A breath. Castellano suggested the relay because he knew it bypassed the standard channels. He was the one who knew about it. I didn't ask how. She thought about that. Castellano, who'd known about a classified relay that was connected to Operation Sandstone, which was connected to her. She wondered how that thread ran, whether it was a direct line or a series of careful referrals through people who knew what that network was for. It didn't matter now. What mattered was the 90 minutes. At 06:58, Torres came back. He had a USB drive and a look on his face that said the last 20 minutes had been worse than he'd anticipated, and he was choosing not to say so. I got the log, he said, and something else. He held out the drive. There's a file on there I don't know what it is. It was in the security archive but flagged for administrative review. I didn't have time to open it. I just pulled it. She took the drive. She needed a computer. Is there a workstation on this floor with offline access? Nursing documentation room, end of the corridor. It's offline. Hospital policy on cardiology floor, no external network connection. Good. She looked at Breck, who had come back in. Petrie? Specialist is secured, Breck said. His voice was level. The weight was still there underneath, but he had it managed. Petrie says the jammer's range appears to be limited to the north and east wings. South and west should be functional. She handed him the drive. Get me that computer, and get your phone to the west side of the building and call my contact again. Same number I used on your phone earlier. Tell him Avery says the timeline is now. Breck took the drive and left. She stayed with Hayward for a moment. His oxygen was holding. His face was tired in the way of someone who had spent significant energy on existing and was finding the return on investment increasingly uncertain. "You're going to be okay," she said. "You don't know that," he said. "No," she agreed. "But I've worked in a trauma bay for 14 months, and before that I did something else for 6 years, and in all of that time the thing I've learned is that the people who are going to be okay have a specific quality. They stay present. They stay focused on the information available rather than the information they're afraid of." She met his eyes. "You're doing that." He looked at her for a moment. "Operation Sandstone. I need to know something." "Ask." What were you exactly? On that mission?" She took a breath. "I was attached to the unit as a trauma specialist, not in a nursing capacity." "Combat medic?" "Combat medic doesn't quite cover it." She paused. "The unit I was attached to needed someone who could handle both the medical element and the tactical element simultaneously, in environments where separating those functions wasn't viable. Special operations medical support. Something like that. They listed you as civilian medical staff on the debrief," he said. "Yes." "Why?" Because the alternative was explaining what a person with my specific training was doing in that valley, and that explanation led to other explanations that certain people didn't want made." She said it evenly, not bitterly, because she'd had enough years with it that the bitterness had composted into something more useful. "I signed what they asked me to sign. I took the civilian posting. I kept doing the work I knew how to do. And then we walked into your trauma bay. And then you walked into my trauma bay." The room was quiet for a moment. Outside, the hospital was fully awake now. She could hear it, the morning shift at full activity, the routines of an institution moving forward in the way that institutions do, regardless of what's happening in their less visible corners. Breck appeared in the doorway. "Come look at this." She followed him to the documentation room. The computer screen showed the security log Torres had pulled, time-stamped entries, camera access records, system commands. And there, at 0317, an access entry that used a command credential she recognized from the facility architecture Breck had described. Voss's signals and communications background, his access to the system from 18 months ago. He'd left himself a back door, which was not surprising, but the specific nature of the back door was more than that. It wasn't just camera access and monitoring. It was file access, administrative record modification. "He's been in the medical records system," she said. "Since last night," Breck confirmed. "Look at the timestamp on the file Torres pulled. 0440. 40 minutes after she'd called her contact from the gas station. 40 minutes after she'd told him to cross-reference Voss against the Sandstone file." "He knew," she said. "He knew someone was pulling that file. He went into the system to create a preemptive defense." "What kind of defense?" She opened the flagged file Torres had pulled without opening. It loaded slowly. A scanned document, multi-page, with administrative headers. She read the first page twice before the full meaning settled. It was a personnel file. Her personnel file. Not her hospital file, sis. This was a different document, one that should not have existed in the Redwood Valley system and had no legitimate reason to be there. It was a version of her record that had been altered. She could see it in the inconsistencies, the gaps where certain entries had been removed, new entries inserted. According to this document, Avery Collins had a history of fabricating medical records, a prior disciplinary action at a previous facility, and a psychological evaluation flagging her for reality distortion under occupational stress. None of it was real. All of it was time-stamped from 3 months ago. Built quietly, sitting in the system, waiting to be needed. "He built a counter-narrative," she said, "before any of this started. He knew that at some point, someone in his logistics network was going to end up in this facility, and he prepared for the possibility that someone on the staff would push back." Breck stared at the screen. "He's been running this for months. At minimum." She thought about the 18-month gap between his security consultation and his arrival as liaison. He hadn't just left himself a backdoor in the system. He'd been building infrastructure, positioning. He's not just covering the mission, he's covering something larger. The weapons components Hayward's unit found. They weren't a one-time event. This is a supply network. It's been running for a while. Her phone buzzed. The number was unfamiliar, but the area code was the same as before. She answered. "Collins." "It's me." The voice was different, tighter, faster, not the unhurried quality from before. The relay pulled Castellano's transmission. It's intact. 43 images, 2 video files, a voice memo. It's been sitting in a classified archive queue for 72 hours waiting for an access request. Can you secure it? Already done. It's been filed through the Inspector General's channel under an emergency evidence preservation order, officially untouchable as of 4 minutes ago. A pause. Collins, the weapons components in those images, we've seen some of them before. Different operation, different region, 6 months ago. There's a pattern. This is not a single bad actor running a side business. This is a network. How high does it go? I don't know yet, but it goes high enough that I've already had 2 phone calls from people asking me to slow down, and I've been working this for less than an hour. His voice dropped. There's a federal investigative team, DoD Inspector General with CID support. They're moving to Boise now. ETA approximately 3 hours. But Collins, there's a problem. Tell me. Voss knows the IG channel was accessed. He has friends in the oversight layer. Not in IG itself, but adjacent. He's going to know a team is coming before they arrive. That gives him a window. How long a window? 2.5 hours, maybe. Which means if he's going to move, against Hayward, against the evidence, against you, it's in the next 2 hours. She looked at Breck. He'd heard enough from her side of the call to read the shape of it. Understood, she said. If the IG team arrives and we've secured the patient and the evidence, is there a channel to expedite their access to facility command? I can make a call to the CID team lead. Give him your name. He'll know to find you first. Do that. She ended the call. Looked at Breck. We have 2 hours before the IG team arrives. Voss knows they're coming, and he has 2 hours to do whatever he's going to do. He's not going to run, Breck said immediately. He's too embedded. Running would confirm everything. No, he's going to try to control the narrative before the team arrives, which means, what can he do in 2 hours from a command position in this facility? They looked at each other. Lockdown, Torres said from the doorway. He'd been listening. If he triggers a security lockdown, the IG team can't just walk in. They need facility command authorization to enter during a security event. It buys him time and puts him in the position of controlling what the investigators see first. On what grounds does he trigger it? He has a detained individual in the north stairwell, Torres said carefully. Man in coveralls. If Voss gets to him first, she was already moving. Petrie. Breck pulled out his phone, dialed, put it to his ear. His expression shifted. Petrie's not answering. She moved faster, into the corridor to the stairwell, taking the stairs to 6 at a pace that acknowledged the urgency without committing to a run she'd regret. Breck was behind her. The 6th floor was quieter in the early morning, the night shift winding down, not enough day shift staff to fill the spaces yet. The north stairwell was at the opposite end. She pushed through the door to the 6th floor corridor and moved. 14 doors, a nurse's station that was currently unoccupied, a supply cart parked against the wall. The stairwell door at the north end opened before she reached it. Petrie came through first, which was fine. The person behind him was not the specialist. It was Commander Derek Voss, in his service uniform, silver hair, blue eyes carrying the particular temperature of a man who had arrived at a decision and was executing it. Beside him were 2 military police officers, different ones from before, older, with the bearing of people who had been briefed more thoroughly. Behind Voss, the detained man in the coveralls was conspicuously absent. Collins, Voss said. He looked past her at Breck, and something moved through his expression, not surprise, but a recalculation. Major, I didn't know you were here. I've been here since 0300, Breck said, coming up beside her. Is that documented? Extensively. Voss shifted his attention back to Avery. I'm afraid I need to inform you that you are currently in violation of your administrative suspension by being present in this facility, and that a security event has been declared as of... He glanced at his watch. Oh, 7:04. The facility is in lockdown. On what grounds? Breck said. A detained individual was found in the north stairwell. Security believes it may be connected to an unauthorized access event occurring overnight. He said it cleanly. He'd had time to prepare the words, probably since before he walked in at 0700, probably since he'd gotten whatever communication told him the relay had been accessed. Medical staff are asked to shelter in place. Non-essential personnel. his eyes on Avery, are asked to exit the facility through the administrative escort procedure. There is no non-essential personnel category in a declared security event, Avery said. Under federal medical facility protocols, all credentialed medical staff, including those on administrative suspension, retain emergency duty obligations when a security event is active. Voss looked at her. The blue eyes did something careful. "You're not credentialed right now," he said. "My administrative suspension was issued verbally with no written order filed through the facility's official HR channel. It doesn't have the standing to override an emergency duty obligation." She said it without heat, without satisfaction, just the particular tone of someone communicating a fact they're sure of. "You'd need a formal written suspension filed with the facility director's office and countersigned by the JAG officer on duty. That hasn't happened." She knew it hadn't happened because if it had, there would have been paperwork, and paperwork created a trail, and Voss had been avoiding trails. Something moved through his expression, something that had been managed and controlled for a long time and was experiencing for the first time the specific pressure of a situation that wasn't going the way it had been designed to go. "This is a security event," he said again. "It is," she agreed, "which is exactly why I need to be with my patient." She started walking. The two MPs looked at Voss. Voss looked at Avery's back. Petrie had moved subtly to a position that made it complicated for anyone to follow her quickly without going through him. She was 6 feet past Voss when he said, quietly, and with a precision that was itself a kind of threat, "You don't know what you're standing in the middle of." She didn't turn around. "I think I have a reasonable idea," she said. She kept walking. She got back to Hayward. Checked his vitals. Oxygen 93, which was down from 94 and needed attention. She adjusted the flow rate, repositioned him slightly, watched the number climb back. His face was pale, and he'd been clenching his jaw, which she noted as a pain indicator. "Voss is here," she said. "I heard moving in the corridor," Hayward said. "He's declared a lockdown. It's a stall. The IG team is 2.5 hours out." She opened the supply cabinet in the room. "I'm going to give you something for the pain. Small dose. I don't want it interfering with your cognition because I'm going to need you to make an official statement as soon as I can get a JAG-authorized recording device." "From who?" "Breck. He has the authority to initiate a preliminary JAG record." She prepared the medication, checked the dosage twice, administered it through the IV port. "This is going to take the edge off. You'll still be functional." What's Voss going to do with 2.5 hours in a lockdown? She thought about the falsified personnel file, the camera systems, the detained operative who had disappeared, the signal jammer, the compound taken from the pharmacy. "He's going to try to make sure the picture the IG team walks into is the picture he designed," she said, "not the one that actually exists." "Can he do that in 2.5 hours? She looked at him. "He's been doing it for 18 months. He just had everything accelerated." Breck came in. He had his phone in his hand, and his expression was the tightest she'd seen it. "Petrie just told me. The specialist we secured, he's gone. The MP team Voss brought in, they released him during the lockdown declaration, cited it as a standard security protocol for detainees. Which means Voss has his operative back," she said, "and knows exactly which room we're in." Breck looked at the door, then at her. "I can get 2 more men here in 20 minutes. I have a team on standby outside the facility. They couldn't come in during the lockdown declaration without facility authorization. But if I can get a federal override, get the CID team lead on the phone," she said. "The number my contact was going to pass to him. Call it directly. Tell him we have a federal witness in protective status, a declared lockdown that we believe is being used to obstruct a federal investigation, and an active threat inside the facility. That'll accelerate the team's movement. That's the point." He was already dialing. She turned to the door and looked at the corridor through the narrow window. Empty. The red emergency lighting was gone. Regular power had been restored at some point, but the quality of the light still felt wrong, the way hospital light always felt slightly off at the edges of a crisis. She thought about Voss, about the 18 months of preparation, about the fact that a man who had gone to that much trouble to build a defensive architecture was not going to spend his remaining window doing administrative work. She was still thinking about it when the fire alarm went off. Not a signal alarm, not an equipment alert. The full facility fire alarm, lights, klaxon, the works. And with it, under federal hospital protocol, the mandatory evacuation procedure that would require every patient on every floor to be moved toward the designated evacuation points. Evacuation points that Voss knew, had helped design, had built into the security infrastructure he'd consulted on 18 months ago. She looked at Hayward. He looked at her. "He's not clearing the building," she said. "He's creating movement, controlled chaos." She was already pulling the IV stand, calculating how fast she could move him and where. Every patient moving toward an evacuation point, every staff member focused on their assigned procedure. And in the middle of all of it, one patient on the 4th floor gets separated from his protection detail in a way that no one will question until it's too late. The klaxon was loud, insistent, designed to override every other consideration. Through the window, she could see corridor movement beginning, nurses emerging, gurneys being readied, the mechanical response of an institution to an alarm it had to take seriously because the alternative was unthinkable. Breck was in the doorway, phone to his ear, shouting over the alarm. She could see from his face that the CID team was responding, but they were 2 hours away. And somewhere in this building, the man in the maintenance coveralls was loose again, with a syringe that had enough paralytic agent to kill a recovering soldier quietly in the middle of an evacuation, in a moment that would be attributed to the stress of emergency movement on a critically ill patient. She locked the room door. It wouldn't hold long. She went to the supply cabinet again, thinking fast, running through what she had available, what she could use, what she could rig, what she knew about this floor's layout and this building's infrastructure from 14 months of working inside it. Her phone buzzed. The number was the contact again. "The CID team is moving," he said before she could speak. "They're pushing for 90 minutes instead of 2.5 hours, but Collins—" He paused. "I just got a flag. Someone filed an emergency personnel action in the last 3 minutes, against you specifically. Psychiatric hold request, citing the altered file in the facility system. If Voss can get a co-signing physician, he needs a co-signature," she said. "He's on his way to the medical director's office right now. Our source inside the facility just flagged it." A psychiatric hold. If it was signed, it didn't just remove her from the floor. It gave Voss the legal mechanism to have her physically removed by medical staff, with no argument she could make in the moment that wouldn't be used against her. It was the cleanest solution he had available. Remove the witness, isolate the patient, control the room before the IG team arrived. She had maybe 15 minutes. "Who's the medical director?" she asked Breck. "Dr. Wanda Kelsch. She's—" He stopped. Something moved through his face. "She was brought in 8 months ago. I don't know her history." 8 months ago, 6 months after Voss's security consultation, 10 months before the mission failure. "Does Kelsch know Voss?" she asked. "I don't know." "Find out in the next 5 minutes," she said, "because if she does and he gets to her office—" The locked door rattled, once. Then someone knocked with the particular authority of someone who knew they were going to be answered. She looked at Breck. He looked at the door. The knocking came again. And then a voice, muffled through the door, but clear enough. "This is Dr. Kelsch. I need to speak with whoever is in this room." Avery opened the door. Dr. Wanda Kelsch was in her early 60s, compact, with reading glasses pushed up on her head, and the expression of someone who had been handed a situation she didn't entirely understand and was deciding in real time how to handle it. She was not accompanied by Voss. She was not accompanied by anyone, just herself, in her white coat, holding a tablet that was displaying something Avery couldn't read from this angle. Behind Avery, the fire alarm was still going. The corridor outside had the organized chaos of a partial evacuation in progress. Gurneys moving, staff calling to each other over the klaxon. The building doing what buildings do when told to. "Dr. Kelsch," Avery said. Kelsch looked past her at Hayward in the bed, at the IV lines, at Breck standing to the left with his phone still in his hand. Her expression did something complicated. "Commander Voss has filed an emergency psychiatric evaluation request on a staff member currently in this room," she said. She said it flatly, without theater. "He wants my co-signature." "Are you going to give it?" Avery asked. Kelsch looked at her directly. "I came here first." The two of them held each other's gaze for a moment. The klaxon was loud, and Avery made a decision based on the quality of that look. The fact that Kelsch had come here first, had climbed to the 4th floor during an active evacuation alarm, had knocked instead of arrived with an escort. "Come in," Avery said. "Close the door." Kelsch came in. She looked at the tablet in her hand. The file Voss submitted with his request contains a psychiatric evaluation dated 4 months ago. Fabricated, I assume, since I've been the medical director here for 8 months, and I've never seen this document through any standard channel. She set the tablet on the windowsill and looked at Hayward. Who is this patient? Sergeant First Class Nolan Hayward, Breck said. My unit. He's a federal witness in an active DOD Inspector General investigation. That's why Voss wants him isolated. That's our assessment, Breck said. Kelsch was quiet for a moment. The klaxon was doing things to the quality of thought in the room. That was its point, to override everything else with urgency. She reached up and pulled her reading glasses off the top of her head and held them in one hand, turning them, a small fidget that looked like a thinking habit. 8 months ago, she said slowly, when I took this position, Commander Voss was part of my administrative orientation. He was helpful, thorough. He walked me through the facility's security architecture in detail. She paused. He also, at one point, mentioned that the system had certain monitoring capabilities that most facility administrators didn't fully utilize. He offered to provide access briefings. Did you take them? Avery asked. I declined. I prefer to learn systems through the standard channels. She looked at Avery. I'm going to ask you something directly, and I need a direct answer. Go ahead. The file Voss submitted. It describes you as someone who fabricates patient information under stress. Is there any basis for that description whatsoever? None. Kelsch held her gaze for 3 seconds. Then she looked at the tablet, picked it up, and did something on the screen. I'm declining the co-signature request and flagging it for review by the facility's ethics board. She set the tablet down again. Now, what do you need from me? The fire alarm stopped. The silence after a klaxon has been running for 10 minutes has a specific quality. Not peace, but the absence of assault. And everyone in the room took half a second to recalibrate to it. In that half second, Avery heard the shift in the corridor outside, the evacuation procedures winding back, staff voices shifting from crisis register to the confused checking in of people who hadn't seen any actual fire. Voss triggered the alarm deliberately, Avery said to Kelsch, as a movement tactic. He needs Hayward isolated and he needs me removed from the building before a federal team arrives in approximately 90 minutes. With the alarm stopped and the psychiatric request declined, he has fewer options, but he's not done. What does he have left? Kelsch asked. He has a loose operative somewhere in the building. He has access to the facility's internal systems that we haven't been able to fully trace. And he has a command position that most of the facility staff will default to following. She paused. He'll move to something more direct. He's running out of time and he knows it. Kelsch looked at the door, then back. What do you need? I need you to post a formal medical hold on this room. Not a psychiatric hold, a standard protective custody medical order for the patient inside. Under your authority as medical director. That overrides any administrative directive Voss can issue and gives Breck's security posture a formal medical backing. Kelsch nodded once, pulled the tablet, began typing. And I need you to send a facility-wide administrative notification that any security directive issued in the next 2 hours that isn't countersigned by the medical director's office is to be held pending review. Avery met her eyes. You have that authority. I do. A pause. I've had it for 8 months and never used it for anything more consequential than a supply dispute. She kept typing. I'll need to send it from the administrative system. The administrative system may be compromised, Breck said. Kelsch looked up. There's an offline administrative terminal in my office that connects directly to the facility's internal distribution network without going through the main server. Voss's orientation included the main server. He didn't know about the offline terminal because I had it installed 6 months ago when we had a malware concern. Avery looked at her. I said I declined his access briefings, Kelsch said mildly. I didn't say I wasn't paying attention to why he offered them. Breck almost said something, then didn't. Avery appreciated both the impulse and the restraint. Go, Avery said. Send the notifications. Get back here as fast as you can. Kelsch left. The 3 of them, Avery, Breck, Hayward, were alone in the room again. The corridor outside had returned to something resembling normal function, staff moving at post-alarm pace, checking on patients, resetting equipment. Hayward spoke first. What happened to the man in the coveralls, the operative? Released by Voss's MP team during the lockdown declaration, Breck said. He's still in the building. We have to assume so. He still has a syringe, Hayward said. Not alarmed, noting it, the way soldiers note tactical facts. Petrie is in the corridor, Breck said. 2 more of my people are at the elevator. Voss knows the corridor layout. Yes. He'll come through somewhere unexpected. Hayward shifted in the bed, which cost him. He absorbed it without comment. That's what you do when you've lost the main channel. You find the gap. Avery was thinking the same thing. She went to the window, 4th floor, looking down at the facility's east parking lot, which was partially occupied with the cars of day shift staff, and the 2 remaining evacuation vehicles that hadn't been stood down yet. Nothing unusual. She moved to the door, looked through the narrow window into the corridor. Petrie was there. The 2 additional soldiers were at the elevator bank. She went back to the supply cabinet. She was thinking about gaps. The room was a standard cardiology recovery unit. It had 1 door, 1 window, 1 connecting door to an ensuite bathroom with no external access. What it also had, she was looking at the ceiling now, was a ventilation access panel above the bathroom, standard in hospital construction for HVAC maintenance. Breck, she said, when Voss consulted on the security architecture 18 months ago, did that include internal access points? Not cameras. Not electronic systems, physical access, maintenance corridors, ventilation. I don't know, he said. Then, but he was thorough. She went into the bathroom. The ventilation panel was standard, white fiberglass, 4 screws, a mesh cover. She looked at the screws. 3 of them had the faint scratching pattern of recent use. The 4th was clean. Breck. She came back out. Get Petrie in here. Petrie came in. She showed him the panel. He looked at it for half a second and then moved to a position to the left of the bathroom door, which put him with a line of sight on the panel and the door simultaneously. Good. She went back to Hayward. She pulled the chair close. I need your statement, she said. Now, before anything else happens. Breck was already pulling a small device from his vest pocket. Secure audio recorder. CID authorized chain of custody protocol. He looked at Hayward. Sergeant Hayward, I am Major Callum Breck, Authorization Code Bravo 7 Foxtrot November. This is a preliminary evidentiary statement under Article 32 Preliminary Procedure. Do you consent? Sergeant First Class Nolan Hayward. I consent. Breck pressed record and set the device on the bedside table. Hayward talked. He talked for 11 minutes. Mission parameters, the drop zone, the weapons components, Castellanos' transmission, the debrief questions that weren't standard, the specific logistics channel whose signature JAG had already identified. He talked about Castellanos' death. He talked about waking up in the ICU and recognizing the nurse who'd treated him, and knowing, in the particular way that soldiers know things about people who've been in the same places, that she was more than she appeared to be. He talked about Operation Sandstone without naming it directly. Just the valley, the timeline, the role of the trauma specialist who had kept 7 men alive through 12 hours in a location that had no business being survivable. When he finished, his voice was rougher than when he'd started, and his oxygen saturation had dropped to 92. She adjusted the flow again and made him drink water, which he did without arguing, which was the most accurate measure she had of how much the 11 minutes had taken out of him. Breck stopped the recording, secured it. That's enough to open a formal proceeding, he said. It's enough to do a lot of things, she said. Her phone buzzed. The contact again. IG team is 40 minutes out, he said. CID team lead's name is Warwick Souls. He's been briefed. He knows to find you. Voss knows the team is coming, she said. We're aware. Souls has federal authority to override a facility lockdown. Whatever Voss tries in the next 40 minutes. From the bathroom, Petrie said. Movement. She dropped the phone. Not hung up. Dropped it on the bed, and moved in 3 steps to the bathroom doorway. Petrie was still in position. The ventilation panel had moved. One corner of it was pushed inward, creating a gap of maybe 2 inches, and from that gap came a thin, almost inaudible sound. Someone on the other side managing their breathing. She looked at Petrie. He looked at her. She held up one finger and he nodded. She went back to the bedside table, opened the drawer, found what she needed. A roll of surgical tape and a pen light. She went back to the bathroom, clicked the pen light to low, approached the panel from an angle, and shone the light through the 2-inch gap. One eye on the other side, looking down. She stepped back, taped the pen light to the wall aimed at the panel, and went to the room phone on the bedside table. She dialed the nursing station extension. "This is Nurse Collins in room 412. I need security to check the HVAC maintenance corridor that connects to this wing. There may be an unauthorized individual in the ventilation system." She said it clearly, loud enough for the sound to carry through the gap in the panel. Pause. Then, from the ventilation corridor, the sound of movement. Not coming forward, going back. Petrie was already out the door and moving. She didn't follow. She stayed with Hayward. The next 8 minutes were the longest kind. The kind where you're waiting for information and there's nothing useful you can do while you wait. She checked Hayward's vitals, adjusted his positioning again. He'd gone quiet in the way of someone managing pain with deliberate breath control, which she respected even while she noted it. "You did well," she said. The statement. "Castellano would have done it better," he said. She didn't have anything to say to that, so she didn't say anything, which was the right call. Breck came back in at the 7-minute mark. Petrie caught him in the maintenance corridor. The syringe is secured. The man is in custody. My people, not facility MPs, and I've already called it into Souls directly, so there's no chain of custody gap. He stopped. Voss is still at large in the facility. He'll know the operative was caught, she said. He'll know in the next few minutes. She thought about Voss, about the specific quality of a person who had spent 18 months building something and was now watching it come apart faster than he'd designed for. People like that, people who were intelligent and prepared and had run complex operations, they had two modes when cornered. One was to try to negotiate their way out, to deploy the same skills that had built the apparatus in the first place. The other was to damage what they couldn't keep. The evidence, she said. The Castellano transmission. That's secured with the IG. Confirmed. The falsified personnel file. Torres has a copy. Yes. Hayward's statement is on the recorder. Yes. She went through the list in her head. Everything that existed, everything that was secured, everything that he could still get to. There was one thing, one piece that wasn't yet in the right hands. The security log Torres pulled, she said. Where is it? Breck checked his pockets, his vest. He looked at the desk in the corner of the room where Torres had set a few items when he'd come in earlier. The USB drive was not there. Torres, she said. Where is Torres? Breck was already on his phone. He dialed, waited. His expression shifted in a direction that made her stomach tighten. No answer. She thought about Torres. Methodical, quiet, competent. She thought about the USB drive, the security log that contained 6 hours of system access data, Voss's backdoor commands, the timestamp at OH317. Without that log, the record's tampering case had gaps. The falsified personnel file existed, but the mechanism, the proof that Voss had accessed the system to create it, the chain of commands showing deliberate, premeditated construction of a false record, lived on that drive. He was in this room, she said. He set things on the desk when we came in. She was already thinking backward. When had Torres last been visibly present? Before the fire alarm. She'd sent him to stand in the corridor and he'd... She went to the door, looked out. Petrie was back from the maintenance corridor. The 2 additional soldiers were at the elevator. The corridor was otherwise staff and patients resettling after the alarm. Torres was not in the corridor. She turned to Breck. He's not on the 6th floor anymore. If he took the drive, either he took it for Voss or someone took it from him. Either way, it's moving. There are 4 exits from this building, Breck said. I can have people on them and he won't go to an exit, not yet. She was thinking about how this facility worked, where a person could be in this building and not be immediately visible. He'll go somewhere to transfer it, hand it off, because he can't walk out with it, not with my CID contact watching the perimeter, she thought. Voss's office. Why there? Because Voss has the access to wipe it. The facility's administrative system, the main server, the one Kelsch's offline terminal bypasses. If he can get that drive to Voss's office and plug it into a system connected to the main server, someone with Voss's level of backdoor access could corrupt the data remotely. She was already moving to the door. And Voss knows his window is closing. He's going to try to destroy what he can't control. Collins, Breck's voice had a warning in it. I know. She stopped at the door, looked back at Hayward, looked at Petrie. Stay with him. Don't let anyone in who isn't Breck or Kelsch. If anyone else comes to that door, call Souls directly." Petrie nodded. She looked at Breck. "With me or not?" He was already moving. They took the stairwell, south end, which was the long way to the administrative corridor, but avoided the north section where Voss's MP team had been operating. 3 floors down, out the stairwell door, into the main building corridor which had returned to its daytime rhythm. Staff moving with purpose. A few patients in wheelchairs near the PT wing, an administrator pushing a cart of folders. The administrative corridor was at the building's center. Marble effect tile, the framed photos, the flags, the view of the parking lot from Voss's office window. The door to Voss's office was open. She and Breck stopped at the corner of the corridor, looked. From this angle she could see through the open door. The desk, the window with its parking lot view. A figure at the desk, not sitting, standing over it. Not Voss. Torres. He had the USB drive in one hand and a cable running to the desktop computer. The computer was on. He was breathing fast, the breath of someone doing something they know they shouldn't be doing but have committed to. She walked in. He looked up. His face did several things in rapid sequence. Surprise, guilt, calculation, and finally a settling into something that looked like desperation. He didn't pull the drive out. He stayed where he was. "How long have you been working for him?" she asked. "I'm not—" He stopped. Started again. "He told me it was a records issue. He said there were patient files that had been improperly accessed by staff, and he needed the security log to identify who was responsible." "He told you that 3 months ago?" she said. "Or this morning?" Torres looked at the desk. "This morning," she said. "You pulled the drive, you were in the room, you heard everything. And then when you were in the corridor, someone from Voss's team found you and told you what to do with it. He said the IG investigation was based on fabricated complaints. He said you—" He stopped again. "He built a file saying I fabricated records," she said. "I know. He showed it to you, or someone showed it to you, and it looked credible enough that when they asked you to do this one thing—" "I'm sorry," Torres said. "It came out small, genuine, which somehow made it worse. I thought—" "Pull the drive," Breck said from behind her. "Right now." Torres pulled it. He set it on the desk. His hand was shaking slightly, which he didn't try to hide. "Is the computer connected to the main server?" she asked. "I don't know. I didn't plug it in. I was about to." She checked the cable, still disconnected at the computer end. The data was intact. She took the drive, looked at Torres for a moment. He was 24 years old and had made a bad decision in a situation he hadn't been equipped to navigate, which was different from being a person who built apparatuses over 18 months to cover weapons trafficking. She noted the difference without letting it fully resolve yet. "Sit down," she said. "Don't touch anything. When the CID team arrives, you tell them everything. Exactly what you were asked to do and by whom. Do you understand?" He sat down. "Yes." Breck was already on his phone, she assumed to Souls, giving the updated status. She turned to the door. Commander Voss was standing in the corridor. He was 15 feet away, and he was alone, which told her that whatever resources he'd been operating with had been progressively stripped from him over the last hour, and he'd arrived at the administrative corridor under his own power, in his uniform, carrying nothing. He looked at her hands, at the USB drive. She looked at his face. The control was still there. It was the kind of control that persisted past the point where it was useful because it was structural, not strategic. But underneath it, for the first time, she could see the shape of what was actually there. Not the evil of a movie villain, but something more mundane and in its own way more disturbing. A man who had convinced himself that the network he'd built, the arrangement he'd maintained, the deaths and falsifications and quiet suppressions, that all of it had been a form of necessary management. That people like Castellano, like Hayward, like Avery herself, were complications in a structure that served some larger purpose he'd defined in terms that made sense to him. "Collins," he said. "Commander." "Whatever you think you have," he said, "it's not going to look the way you think it looks to the people reviewing it." "The IG team will make that call," she said. "The IG team will see a nurse with no formal military background who gained access to a restricted federal witness by claiming personal connection, manipulated the facility's medical director, and coordinated with outside contacts to introduce federal oversight into what is an internal military matter." He said it evenly, like a brief. "That's a coherent narrative." It is, she agreed, except for the Castellano transmission, which is already secured with the Inspector General's office and documents weapons components that trace back to a logistics channel you signed off on. She paused. And Hayward's recorded statement, and the security log showing your system access timestamps, and the altered file you built in this system 4 months ago. She let that settle. That's a lot of counter-narrative. His jaw moved. Something in his expression recalculated. You know what your problem is, Commander? She said. It was not triumphant, it was just said. You planned for a nurse. You built your whole contingency around removing a nurse. You never actually looked at what you were looking at. From down the corridor, the sound of the main entrance, movement, voices, the particular cadence of people arriving with authority and purpose. Breck turned from his phone. Souls is here, 20 minutes early. Voss heard it too. His expression went through something that had no clean name. Not quite collapse, because he was too controlled for that. But the specific moment when a structure meets the force it was not built to withstand. CID Special Agent Warwick Souls came through the corridor with 4 agents and a uniformed military escort that moved with the quiet efficiency of people who had done this before. Souls was 40, lean, with the kind of face that took in information and showed very little about what it was doing with it. He looked at Voss, at Avery, at Breck, at the open office door. Commander Derek Voss, he said. Not a question. Agent, Voss said, I'm going to need you to come with me. I'd like to speak with JAG Council first. That's your right, and it'll be arranged. Souls looked at his team, and 2 of them moved to flank Voss in the specific professional way that meant the next part wasn't optional. He turned to Avery. Collins. Souls. I understand you have a drive. She held it up. He looked at it the way people look at things that are going to determine a lot of what happens next. Chain of custody, he said, and one of his agents came forward with an evidence bag. She placed the drive in it. The agent sealed it, initialed it, handed it back to Souls. She watched Voss being walked down the corridor. He was cooperating. Of course he was, because that was what controlled people did until the moment they couldn't anymore, and his lawyers would tell him the same thing when they arrived. He did not look back. She let out a breath that she hadn't been aware of holding. Breck came to stand beside her. Neither of them said anything for a moment. Torres, she said. I'll handle the interview, Breck said. He was manipulated. It'll factor. It should. Souls came back. I need a full account, in order. Start from when the unit arrived Monday morning. I need to check my patient first, she said. How long? 10 minutes. I'll be in the conference room. She went upstairs. Petrie was at the door. She went in. Hayward's oxygen was at 93, which was lower than she wanted. She adjusted the flow, checked his BP. Still low but holding, and the pain medication had helped because the tension in his jaw was less. He was awake. Is it done? He asked. The first part, she said. She meant it. The arrest of Voss was a moment, not a resolution, and she'd been around long enough to know the difference. There was still a network, still the question of how high it went, still Torres and his interview and the legal architecture of what came next, which would be months of process, not a single morning. Castellano, Hayward said. The transmission is secured, she said. His documentation is evidence of record now. It's in the right hands. Hayward was quiet for a moment. He knew what he was doing, he said finally. When he transmitted, he knew what it might cost him. She didn't have anything to add to, so she just sat with him for a moment in the kind of silence that wasn't empty. Then she stood. I have to go give a statement. You'll be moved to a properly secured room as soon as Souls' team establishes the protocol. You're not going to be alone. Collins. He said it as she was at the door. Sandstone, the valley. I've been carrying that for 4 years, wondering who you were. What happened to you after? She turned. Now I know, he said. She looked at him. A man who had survived things he wasn't supposed to and was now lying in a hospital room that had been a battlefield this morning, with IV lines in his arm and a surgical site that was going to take months to properly heal and a long legal process ahead of him that was going to require him to recount things he'd probably rather not recount. Get some rest, she said. The hard part isn't over. I know. A pause. But it's different now. She nodded, went to the door, opened it. In the corridor, Souls was waiting with a notepad and a cup of coffee he hadn't offered to share, which she respected because she didn't want it. Behind him, through the window at the end of the hall, the October sky over Boise had finally made its decision and was delivering the snow it had been threatening. Light, early, the kind that didn't stick but meant something. She walked toward Souls and began to talk. She talked for 2 hours. In the conference room with the flags and the framed photographs, she went through everything in order. Monday morning, the unit arriving, the IV line, the falsified note, the suspension, the phone calls, the stairwell, the overnight events, the fire alarm, Torres, the ventilation panel, the drive. She was precise about what she had directly witnessed and clear about what was inference, which Souls appreciated in the specific way investigators appreciate witnesses who know the difference. When she finished, Souls looked at his notes for a moment. Then he looked at her. "There's a section of your background that's redacted in the facility file," he said. "Yes, the sandstone reference in Hayward's statement. That'll need to come through a separate channel," she said. "There are people who can authorize the release. I can give you a name." "Is it the same name you called from Breck's phone?" She looked at him. "That's an interesting question to ask. I'm an interesting kind of investigator." He closed his notepad. "Collins, what you did in this facility over the past 4 days, I need you to understand that from a formal standpoint, several of those actions existed in a legal gray area." "I know. Badge suspension, unauthorized access, unofficial evidence gathering. I know. The fact that the evidence is solid and the witness is alive and the chain of custody is clean, those things matter, but they don't retroactively legalize everything." "I understand," she said. "What are you telling me?" He looked at her steadily. "I'm telling you that the IG office is going to be building a case that needs to be airtight, and that having the primary witness and the facility's key evidence handler be someone with a redacted background and an active administrative suspension creates complications we need to manage carefully." He paused. "I'm also telling you that Warwick Souls has been doing this for 15 years and has never seen a 4-day sequence that moved this much evidence through this many obstacles and came out this clean." Another pause. "That's not an official statement. It's just a thing I'm saying." She nodded once. He stood, extended his hand. She shook it. "Don't leave Boise," he said. "We're going to need you available." "I'll be at work," she said. He looked slightly surprised. "Kelsch reinstated you." She sent the notification 20 minutes before Voss was taken into custody. She paused. "Effective immediately. Full trauma unit." Souls almost smiled. It was a very small thing, but it was there. "Good," he said, and walked out. She sat in the conference room for a moment by herself. The framed photographs of dignified handshakes looked down at her. The flags stood in their holders. Outside the window, the snow was getting slightly heavier, still not sticking, still making its argument. Her phone buzzed. The contact. "Voss is in CID custody," he said. "I know, I was there." "The network he was part of. It's bigger than this facility. The IG is opening parallel tracks in 3 other locations." A pause. "Collins, there are people who are going to want to debrief you formally about Sandstone, about your post-operational period. I expected that. It may change things. For your clearance status, your operational classification." She thought about this, about what it would mean for the person she'd built in the last 4 years, the life that was genuinely hers, even if it sat on top of something older. The trauma unit, Marcus with his not-quite-accurate time calls, Dr. Rubin with her coffee and her precision, the veteran who'd talked about his granddaughter's soccer tournament. "Let them debrief me," she said. "I'll answer what I can answer." "And then?" She looked at the window, at the snow. "And then I'm going to go back to my unit," she said. "I have patience." She hung up, sat for another moment. Then she stood, straightened her scrubs, wrinkled from a night in a motel and a morning that had required things scrubs weren't designed for, and walked out of the conference room, down the corridor, and toward the elevator. She pressed the button for the trauma floor. In the elevator, alone, going up, she finally let herself feel the weight of the last 4 days. Not process it, not analyze it, just feel it, for exactly as long as the elevator took to reach her floor. The doors opened and she stepped out and the weight went back where she kept it. Marcus was at the nursing station. He looked up. His expression went through 6 things in 2 seconds and settled on something that was the professional equivalent of relief, which for Marcus was considerable. "You're back," he said. "I'm back." "You look like you slept in a motel." "I did." He handed her a chart. "Room 7 has been waiting for a dressing change for 40 minutes, and the patient is specific about wanting a specific nurse." She took the chart, looked at it. It was a veteran, mid-50s, routine wound care follow-up. "The granddaughter's soccer team," she said. Marcus looked at her. "What?" "Nothing." She started walking. "I'll be in room 7. She was 6 steps down the corridor when Marcus said, without looking up from his station, "Glad you're back, Collins." She didn't turn around. "I know," she said. She knocked on the door to room 7, opened it, and went in to do her job. The veteran in room 7 was named Darnell Pruitt, and he had opinions about his wound dressing that he communicated with the specificity of a man who had spent 30 years in logistics and believed that precision mattered in all things equally, including the angle at which medical tape was applied to his forearm. "The last nurse pulled it too far left," he said. "I see that," Avery said. She was examining the existing dressing, which was fine. Slightly asymmetric, maybe. "How's your granddaughter's team doing?" He shifted in the way people shift when a subject they care about becomes suddenly available. "One Saturday, 3-2. Maya scored the first goal." He paused. "She's 9. That's a good age for soccer." "It's a good age for everything," he said, with the particular conviction of a grandfather. "You have kids?" "No." "You should," he said. Then, apparently realizing this was a thing people weren't supposed to say anymore, "I mean, whatever. It's your life." "It is," she agreed, and finished the dressing at an angle he appeared to find acceptable. She worked through the morning. 4 more patients, routine in the way that trauma unit mornings could be routine. A post-surgical follow-up, a medication adjustment, an incoming transfer from the ER that required 40 minutes of focused work and left her with the particular tired satisfaction of a thing done correctly under pressure. She ate half a granola bar standing at the nursing station at 11:30. She drank 3 cups of coffee. She did not think about Voss or the CID team or the drive or the network or any of it, not because she was suppressing it, but because she had learned over a long time how to put things in the right compartment for the right hour. The compartments got reorganized at 1:15 when Souls appeared at the unit entrance and asked if she had 10 minutes. She had 10 minutes. They stood in the corridor outside the break room, not a formal setting, which she thought was intentional. "Voss gave a preliminary statement this morning," Souls said. "He asked for a deal." "What kind of deal?" "The kind people ask for when they know the evidence is solid and they want the sentence to land on someone else where possible." He said it without inflection. "He's providing the names and structure of the logistics network in exchange for cooperation credit. It's not going to save him. What he did, the extent of it, the Castellano element, that's not something you cooperate your way out of. But the names he's providing are significant." "How significant?" "Significant enough that this is no longer a regional CID matter. Federal prosecution, joint DOD-DOJ investigation, looking at weapons export violations, conspiracy, at minimum 2 counts of first-degree related to Castellano and the attempt on Hayward." He met her eyes. "They're also looking at the Sandstone redaction. There are people on the investigation who believe the original decision to classify your operational role and list you as civilian staff was itself irregular." She processed that. Meaning someone at some point may have had a reason to keep your specific skills out of the official record that had nothing to do with operational security. He paused. "That's a separate track. It's going to take time, but the IG's office has flagged it." She stood with that for a moment. 4 years of a story she'd told herself. That the classification was protocol, that the non-disclosure was standard, that the quiet reassignment to civilian life was just how these things worked. The possibility that it had been something other than neutral procedure sat in her chest like a stone she'd been carrying without knowing it had a name. "Okay," she said. "That's all you've got? Okay?" "I've had 4 days of a lot of things," she said. "I'm saving my reactions for when I have more information." He looked at her for a moment. "You know," he said, In 15 years, I've interviewed maybe 800 people in situations with this much personal exposure. Most of them, even the ones who did everything right, are falling apart by this point. Anger, shock, some version of it. I'm not falling apart. I can see that, he paused. I'm not sure if that's admirable or concerning. It's neither, she said. It's just what I look like. He almost did the almost smile again. Hayward is being transferred to Mountain Home this afternoon. Properly this time. Full escort, secured transport, continuous monitoring. He asked me to tell you something. What? He said, tell her the valley was worth it. He said you'd know what that means. She did know what it meant. The valley. 12 hours, 7 men. A perimeter that had held because she'd made decisions under conditions that hadn't offered better options, and had carried the weight of those decisions ever since in the specific way of someone who knows both what it cost and what it purchased. She had never been sure, in 4 years of quiet civilian life, whether the arithmetic had been right. Hayward, apparently, had done the math. Tell him I said good, she said. It wasn't everything she would have said if she'd had the right words, but it was true, and true was enough. Solis left. She went back to work. The weeks that followed were not clean. They were not the kind of aftermath that movies construct. No press conference, no single dramatic moment of vindication, no ceremony in the first days. What there was instead was the grinding, unglamorous machinery of institutional reckoning, depositions and formal statements and follow-up interviews, a review board convened to examine her administrative suspension, another review of the facility's security infrastructure, a separate process initiated by the JAG office into the circumstances of Castellano's death that moved slowly and then all at once when Voss's cooperation produced 3 additional names in the logistics network. She worked through all of it. Morning shifts, afternoon shifts, the occasional overnight when they were short-staffed, and she was the person Marcus called because she was reliable, and he knew it, and she knew he knew it, and neither of them needed to discuss it. She went home at night to her apartment and ate actual meals because she'd started paying attention to the fact that she'd been running on institutional coffee and inadequate sleep, and that was a thing worth correcting. She called her sister in Portland twice, which was twice more than she'd called in the previous 3 months. And the conversations were imperfect and a little awkward in the specific way of people who love each other and have let distance grow and are now trying to close it without directly addressing the closing. Human things. The kind that don't get included in operational reports. The formal review board convened 6 weeks after Voss's arrest. It sat for 3 days, reviewing everything: the suspension, the overnight events, her actions during the lockdown, the badge access, all of it. She testified for 4 hours on the second day. She answered every question directly and flagged the ones she couldn't answer in full without the sandstone clearance, which had been partially lifted by then, enough for the board to understand the shape of what it couldn't see. The board's finding was issued on a Thursday afternoon. Marcus forwarded it to her from his email because she didn't check her hospital email on her days off as a policy. She read it at her kitchen table with her second cup of coffee. It found that her administrative suspension had been issued without proper documentation and therefore had no legal standing. It found that her actions during the security event had been consistent with emergency duty obligations under Federal Medical Facility Code. It found no basis for any of the allegations in the fabricated personnel file, which it described in language that was formal and measured but whose meaning was clear. The file was a deliberate falsification created by a facility commander for personal operational purposes, and every record associated with it was to be expunged. The last paragraph noted, in the dry, careful prose of institutional documents, that Nurse Collins's actions had been directly instrumental in preserving critical federal evidence and protecting a material witness in an active investigation, and that this finding was being forwarded to the facility director's office for consideration of formal commendation. She set the email down, picked up her coffee, looked out the window at the Boise November, which had committed fully to winter now. Real snow on the ground, the mountains visible on clear days with a clarity that the summer heat haze never quite allowed. She thought about the word commendation, about what it would look like on paper, in a file, and whether it would mean anything to the person who'd been called sweetheart in a trauma bay 4 days before everything broke open. She decided it meant something, and also not as much as people expected it to mean. Both things at once, which was usually how the significant things worked. The facility director called her personally the following Monday. His name was Dr. Ortega. and she had spoken to him exactly twice before, both times in administrative contexts, both times briefly. He was thorough on the phone, which she appreciated, and he said the things she expected him to say, and then at the end of the call, he said something she didn't expect. "I want you to know," he said, "that the way this facility treated you was wrong. Not just Voss. The institutional conditions that made what Voss did possible. The environment in which a commander could suspend a nurse's badge access on an informal complaint and have it stick. Those conditions existed before Voss, and they're going to require more than his arrest to change." A pause. "I'm not going to pretend I have a clean solution to that, but I want you to know it's named." She sat with that for a moment. It was not a thing she'd expected to hear from a facility director, and she was not sure what to do with it, and she said so. "You don't have to do anything with it," he said. "I just wanted to say it." It was, she thought later, one of the most useful conversations she'd had in weeks. The commendation ceremony was scheduled for the second week of December. She'd been told it would be low-key, administrative, not public. And then 2 days before, Dr. Rubin told her over coffee in the break room, in the particular tone Rubin used when she was delivering information she found mildly funny, that it was not going to be low-key. "Breck's entire unit is coming," Rubin said. "How do you know that?" "Because Major Breck called the nursing unit this morning to ask if the conference room could accommodate 22 people. Rubin sipped her coffee. "Also, someone from the DoD Inspector General's office called to confirm the date. And Dr. Kelsch told me she's wearing her dress jacket, which I've never seen her wear." Avery looked at her coffee. "I hate this kind of thing." "I know. I'm not good at standing at the front of rooms while people—" "I know that too." Rubin set her cup down. "Collins, let them do it. You spent 4 years making yourself small so that the thing you actually were wouldn't make the people around you uncomfortable. Let them see it. One morning. That's all it is." She didn't have a clean argument against that, so she didn't make one. The morning of the ceremony, she wore her regular scrubs because she'd decided she was a nurse, and she'd come to this place as a nurse, and that was the identity that was hers without asterisk or qualifier. She walked into the conference room at 0900 and found 22 soldiers, Dr. Kelsch, Dr. Ortega, Dr. Rubin, Marcus, 3 members of Solz's CID team, including Solz himself, and 2 people she didn't recognize who had the specific bearing of people from offices that didn't put their names on their doors. Breck was standing near the window. He looked like a person who had slept better in the last 6 weeks than he had in the previous year, which she thought was probably accurate. He nodded at her when she came in. She nodded back. The ceremony itself was 20 minutes. Ortega spoke first, the formal commendation language, the specifics of what she'd done and what it had preserved. Then Solz briefly, the CID perspective, which was precise and complimentary without being effusive. Then Kelsch, who was the shortest speaker and also, Avery thought, the most honest. She talked about opening a door on the 4th floor during a fire alarm and finding a nurse who was solving 4 problems simultaneously, and said that she had learned something that morning about the difference between the authority you were given and the authority you carried. Then Breck stood up. He wasn't a natural speaker. He was a man who communicated better in small rooms with direct purpose, and standing at the front of a conference room with 22 of his soldiers watching him was not his environment. He knew it, and he didn't pretend otherwise. "I'm going to keep this short," he said, "because the things worth saying aren't improved by length." He looked at Avery. "I filed a complaint against you 4 days before all of this started. I filed it because I was frustrated and I made an assumption about who you were based on the role you occupied. I was wrong about that, and I want to say it in this room, in front of these people, because it matters where you say things." He paused. "Hayward is recovering at Mountain Home. He asked me to be here. He wanted me to tell you—" He stopped, something moving briefly through his face. "He said you knew what the valley meant. He said tell her it mattered, and it still does." He looked at the room. "What I know from my time in this is that the people who do the hardest things are usually the people nobody sees coming, the ones who look quiet, the ones you underestimate because it's convenient to underestimate them." He looked at Avery again. "We are fortunate that the person standing in that trauma bay on Monday morning was Avery Collins. And I will carry that particular fortune with appropriate humility for the rest of my career." He sat down. The room was very quiet for a moment. Then someone started clapping, and it moved through the room the way things move when everyone has been waiting for the moment to release something they've been holding. She stood at the front of the room and let it happen. She didn't cry because she wasn't a person who cried in front of 22 soldiers and 2 people from offices without names, but she felt the full weight of it, not the applause, not the ceremony, the weight of what it meant to be seen. After 4 years of careful invisibility, after a week of being called sweetheart, being suspended, being the thing a powerful man tried to erase, after a valley she wasn't supposed to have been in, doing work she wasn't supposed to have done, for people who survived because she was there, to be seen, correctly, without the diminishment or the inflation, just the accurate view of a person who had made difficult decisions in difficult circumstances and had done so imperfectly and humanly, and with the full weight of her own flawed judgment and training and will. It didn't solve anything. It didn't undo Castellano, whose name had been spoken in this building more in the last 6 weeks than in the entire rest of his life combined, whose family had been notified of the circumstances of his death, and who were now part of a wrongful death proceeding that would take years. It didn't undo the network that was still being dismantled node by node, or the other facilities, or the other questions that were still being asked. It didn't make her into something she wasn't. She was still a person who had nightmares occasionally about the valley, still a person who had signed documents she disagreed with because she hadn't known yet what refusing cost compared to what complying cost. Still a person who was better at being useful in a crisis than she was at calling her sister on a regular basis or eating breakfast before 8 in the morning. But to be seen, exactly as she was, that mattered. She hadn't known how much until the moment it happened. After the ceremony, people moved toward coffee and the pastries that Marcus had apparently organized, because Marcus was the kind of person who organized pastries at the precise moments when pastries were needed. Avery found herself in a conversation with one of the 2 people from the unnamed offices, a woman in her 50s, short-haired, with the steady eyes of someone who had made many significant decisions and lived with all of them. "The Sandstone record review is nearly complete," the woman said. She didn't offer her name, and Avery didn't ask. "There were irregularities in the original classification decision. You were classified as civilian staff without your explicit consent to that specific designation. The review board is recommending a formal correction to the record." "What does that mean practically?" "It means your operational role is officially documented. Your contributions are on record under your actual designation." A pause. "It also means that the people who made that classification decision are being asked to account for it." She thought about 4 years, about the apartment in Boise and the trauma unit and the careful construction of a life that was genuinely hers, even while something important about her was stored in a locked file somewhere, inaccurately labeled. "Thank you," she said. "Thank yourself," the woman said simply. "You surfaced it." She hadn't chosen to surface it, not exactly. Circumstances had chosen for her, and she'd responded to circumstances, but she understood what the woman meant, that the choice, when it came, had been made in a specific direction, and that direction had mattered. Later, when the room had mostly cleared, she stood at the window with her coffee, actual good coffee, someone had brought a proper thermos, and looked at the December sky over Boise. Clear today, cold. The mountains sharp on the horizon. Breck came to stand beside her. They didn't say anything for a moment. "How's the unit doing?" she asked finally. "Adjusting. This kind of thing, when it comes out that someone in the chain was operating against you. It takes time to work through." He turned his coffee cup in his hands. "They're doing the work." "Good. Hayward is going to be on light duty for 6 months. He's already complaining about it." A pause. "He asked if he could write to you, formally. Not text, actual letter. He said some things needed the right format." "He can write," she said. Another quiet moment. Outside, a transport vehicle moved through the parking lot. An ordinary Tuesday at a military medical facility, the machinery of the institution running the way it ran, patients, staff, the continuous cycling of need and response. "Collins," Breck said. "What's next for you?" She thought about this. It was a question she'd been asking herself in the small hours of recent mornings, not with anxiety, but with the genuine curiosity of someone standing at a place where the path had just opened up and could go several ways. The unnamed woman's words sat with her, the record corrected, the operational designation restored, the accounting underway. She could go back. There were people who would make that available to her now that the Sandstone record was being corrected. She had skills that were not common and a track record that was, on paper, now accurately documented. Or she could stay. Here, in this unit, in this hospital, doing the work she'd been doing for 14 months. The work that was also genuinely hers, that she was also genuinely good at, that had given her Pruitt and his granddaughter's soccer team, and Reuben with her coffee, and Marcus and his approximate timekeeping, and 100 other small human moments that the operational life did not offer in the same way. Or something else entirely, some third thing she hadn't named yet, that existed in the space between who she'd been and who she was becoming. She didn't know. She was comfortable not knowing, which was itself something she'd learned, that certainty was not a prerequisite for moving forward, that you could take the next step without being sure of the 10th. "I'm going to finish my shift," she said. "Then I'll figure out the rest." Breck made a sound that was not quite a laugh, but was adjacent to one. "That sounds right," he said. She finished her coffee, set the cup down, looked at the mountains one more time, the way they sat on the horizon with complete indifference to everything happening at their feet, the way they would be there regardless of arrests or commendations or corrected records or any of the human machinery that produced meaning out of circumstances. Then she turned from the window and went back to her unit. There was a patient in Bay 3 who needed a wound assessment, a medication chart that needed updating, a family in the waiting room who had been there since 7 and needed someone to come out and talk to them with honesty and care and the particular human steadiness that the worst moments required. She went to Bay 3 first. She knocked on the frame and went in and introduced herself the way she always did. Just her name and her role, nothing more or less than what was true. The patient was 43, a veteran, a blast injury from 12 years ago that still required management, a man who had learned to live with something permanent and was doing it with varying degrees of grace depending on the day. Today was not a great day. She could read it in the way he was sitting, the particular defeat of a person who had woken up that morning and found the thing they'd made peace with had stopped honoring the peace. She pulled up the chair. She sat. "Tell me what's going on," she said. He told her. She listened. Not with the clinical detachment that looked like professionalism, but actually was a form of distance, with the full, present, human attention that the work required, and that she'd always given to it, even when the institution around her hadn't given it back. This was the thing no one put in commendation reports. This, the chair pulled up, the actual listening, the being, with someone in the unglamorous middle of what they were carrying. The part that didn't look like heroism, because it didn't have the shape of heroism, but was, in its own quiet way, the entire point. She had spent years being underestimated, years having her usefulness defined by the parts of herself that were visible and the category she'd been assigned. She had spent 4 days being the person no one expected her to be, in circumstances that had required everything she had. And she had come through it and been seen and been named and been given back something that had been taken. But she had also always known, in the valley and in the trauma bay and in this chair in this room, that the thing she carried was hers regardless of whether anyone recognized it. That you did not become capable by being seen. You became capable by choosing, over and over, to be present for what was in front of you. By not walking away from the thing that needed doing just because the institution didn't have a category for the person doing it. The patient in Bay 3 was talking. She was listening. Outside, Boise was going about its December morning. The mountains were where they always were. The work was what it always was. And Avery Collins, nurse, combat medic, the woman the valley had already proven before anyone in this building thought to look, was exactly where she chose to be.